hearing of the Committee on Finance to hear bills granting benefits to our healthcare workers during the pandemic. We have Senate Bill 2371, filed by this representation and Senator Dick Gordon, Vice Chair of the committee. We have Senate Bill 2406, filed by Vice Chair Senator Bato de la Rosa, and Senate Bill 2398, filed by Finance Committee Vice Chair and Health Committee Chair Senator Bongo, who's also with us, I believe, I was told. No? We'd also like to acknowledge the presence of one of the committee vice chairs, Senator Joelle Villanueva. Good morning, sir.
Morning,
And thank you for
Mr.
joining
Chair.
us. Thank you, Your Honor, for joining us. And I was told Senator Tolentino is also here. Morning. To our health chair, Senator Bongo. Morning. And to the DOH family, of course, we'd like to acknowledge the presence of DOH Secretary Duque, Yusek Leopoldo Vega, Yusek Roger Tong-An, Yusek Mario Villaverde, ASEC Nestor Santiago, and Director Angelina Del Mundo. For DBM, we have Director Jane Abella, Ms. Jillian Servida, Ms. Grace Darunday, Mr. Paul Vincent Perocho, Mr. Carlo Miguel Centeno, and for DOF, Director Brion. For PhilHealth, we have VP Shirley Domingo, League of Provinces, Ms. Angelica Sanchez, Philippine Medical Association President Benito Atienza, Dr. Rogelio Dazo Jr., Filipino Nurses United President Abenohar and Ms. Andamo, St. Luke's Medical Center Global City Employees Union Mr. Benji Foscablo, Philippine Nurses Association President Melbert Reyes, and Zeni Concepcion, Philippine Red Cross, former SEC of DOH Dr. Paulino Bial, Ms. Maria Teresita Villanueva Leido, National Confederation of Barangay Health Workers of the Philippines National President Zenaida Pulido. This is the list given to me by the staff. Please let us know if there are additional guests. And again, we have ASEC Beltran of DOH. And so just before we turn it over to our colleagues for and our resource persons for any initial remarks, we'd like to mention that
Mr. Chair. Yeah, Robert Mendoza from the Alliance of Health Workers.
Mr. Mendoza, thank you. You're acknowledged.
Thank you, sir.
Thank you for attending. We'd like to mention that this hearing was brought about as an offshoot of the Senate investigations into the receipt or non-receipt of health benefits by our health workers contained in the Bayanihan laws, and in view of the executive branch that the Bayanihan 2 health benefits have lapsed, we were constrained to file these bills and urgently to hear it. Because the committee is scheduled the bills for hearing immediately upon referral. It was initially referred to another committee and was transferred to our committee last week, last Wednesday, I believe. So in short, we grant the same benefits as Bayanihan 2, the monthly SRA or Special Risk Allowance, active hazard duty pay, the assumption of medical expenses in case of exposure to COVID-19 and work-related injury or disease, life insurance accommodation, transportation and meals, compensation benefits for those who are afflicted with COVID-19. So those are some of the provisions and some of the issues to be tackled, which must be settled hopefully by today or in the next succeeding days. How many will be covered? The coverage of the law, the issue of tax-free, whether it will be tax-free, because the DOF is saying that there are lost revenues. The amounts, I think, the range of amounts to be received, the actual monetary equivalents. Those are just some, Your Honors, of the issues that we hope to settle today so we can come out with a committee report at the soonest time. We'll ask our colleagues if there are any of them who want to deliver some initial statements, particularly the authors of the measures. We'll give them first crack. Senator Bato, yeah, go ahead. You're author of Senate Bill 2406. Go ahead, sir. Vice Chair De La Rosa.
Thank you, Mr. Chairman. Good morning to everyone. Before anything else, I would like to express my sincere thanks to the good chairman of the Committee on Finance, Senator Sani Angara, for hearing these bills today. These bills have one and only one intent: to make sure that our healthcare workers are well compensated, especially as they find themselves at the front lines of this global pandemic. It was in November of 2020 that I discovered that I, along with my eldest daughter, tested positive for COVID-19. Needless to say, it was a difficult and challenging time for us. I realized, Mr. Chairperson, the value of being able to breathe freely and fully. I realized the value of a strong immune system. Most importantly, I realized the incomparable sacrifice of our healthcare workers. I saw this in the person of my daughter, Liz. She herself is a licensed nurse. And even when we were both sick, halos hindi na niya iniisip ang sarili niya. I was always her top priority. Kahit na nawala na siya ng panlasa at pang-amoy. Excuse me, Mr. Chairman. Medyo nawala ako. Medyo nakikarried away ako. Dahil sa experience natin, alam ko, dinaanan mo rin ito.
Understandable ho. Understandable, Your Honor.
Sorry, everyone. She is just one of many selfless healthcare workers. And the bulk of our COVID-19 response rests on their tired shoulders. We can call them modern day heroes and lavish them with praises on social media. This will not be enough, especially when we know that their own lives and the lives of their loved ones are at stake. Beyond being called heroes, our healthcare workers are entitled to just compensation and proper care. If this is one way for me to concretely express my gratitude to my daughter and to all the healthcare workers who are the most vulnerable during these times, then I personally commit myself to ensuring the passage of these bills. Thank you, Mr. Chairman.
Thank you. Very well said. And thank you. Appreciate the sentiment, Your Honor. Salamat po sa inyo at saka yung anak ninyo sa serbisyo. Would Senator Joelle care to deliver any remarks? Vice Chair
Yes.
Villanueva? Sir, go ahead, sir.
If I may, Mr. Chair, thank you.
Yes, please go ahead, sir.
Thank you, Mr. Chair. Maganda at mapagpalang araw po sa ating lahat, sa ating mga colleagues, Senator Bato, ating chairman, Senator Bong, Senator Tolentino, sa ating mga guests, buong DOH family headed by Secretary Duque, I saw Secretary Pauline, and of course our healthcare workers na kagaya ng binanggit ni Senator Bato, saludo ho tayo at nais nating ipakita how much we really care for them, not just yung mga pinopost sa Facebook or sinasabi natin. We wanted to make sure na we're doing something for them, and this is the reason why I'd like to commend our chair and thank him for calling this hearing. Our colleagues also who filed these measures, very timely measures to institutionalize the COVID-19 benefits for our healthcare workers. You know, Mr. Chairman, I'd like to spread into the record that just like some of our colleagues, or perhaps majority of us, were dismayed when we heard that there were budget slashes in the health sector. Hindi naman po nababawasan ang pila at pangangailangan sa mga COVID referral hospitals, kagaya ng Lung Center of the Philippines, NKTI, Philippine Children's Medical Center at Philippine Heart Center. And I think it's common sense that COVID muna ang tustusan natin ng pondo, and that the government should put the money where its mouth is. I'd like to spread into the records that perhaps with the measures that will be tackled today, we hope to explore what else we can do as policymakers for our healthcare workers. Kailangan po nating busisiin ang proseso ng pag-download ng pondo mula sa ating mga ahensya ng gobyerno hanggang umabot ito sa kamay ng ating mga frontliners. benepisyo muna ang unahin natin, Mr. Chairman, bago mga buildings, etc., dear colleagues. Tingnan din po natin kung mas mapapadali at mababawasan ang paperworks kung fixed at hindi prorated ang mga benepisyo. Binanggit nyo kanina, Mr. Chairman, yung kahalagahan, ang pagbibigay ng tax breaks, ng tax exemptions, etc. Maganda kong tignan natin yan. Maaari din po siguro nating pag-aralan kung yung pagbibigay ng mga benepisyo sa mga private healthcare workers ay nasa kamay ng Department of Labor and Employment. Kasi may experience po tayo sa tupad, 19 billion yung pondo nila this year. And maganda po yung kanilang track record sa pagbibigay nito, no, yung sistema nila. We just want to learn, Mr. Chairman, from our experiences in the previous years of this pandemic. And the bottom line is streamline and expedite our process. Mr. Chairman, we also run some numbers, and if we want to give more or less 120,000 healthcare workers composed of doctors and nurses based on the DOH Human Resources for Health Personnel data as of December 31, we wanted to double the amount of special risk allowance and active hazard duty pay. We need more or less about, and we run these numbers, Mr. Chairman, 23 billion pesos to finance these two benefits. This can be our baseline figure. With this number, we need to determine how we can expand the budget to the actual figure of healthcare workers, including non-medical healthcare workers working in hospitals that are at risk of contracting COVID-19. We can also determine how much will be needed for other benefits such as COVID claims, and meals, accommodation, and transportation allowances. Ang sa akin lang, Mr. Chairman, kahit idoblehin ho natin ito at ikumpara natin sa Vietnam, mas mataas pa rin yung sweldo ng mga healthcare workers doon sa Vietnam. Last 2 years ago, doon sa ating pagdinig sa Committee on Labor, yung POGOS, 50 billion yung utang sa atin. 50 billion. What is 23 billion na madoble natin ito? So lastly, Mr. Chairman, gusto ko lang sabihin na importante po, and I'm sure the Chairman of the Committee on Finance is also aware of this. We have been pounding on this. So kung posible ho, because we noted in the 2020 COA audit report of COA, doon po sa DOH, they had 25,067 job orders, contractual consultants, and human resources for health personnel serving as an additional workforce to the regular plantilla positions. However, they also revealed during our hearing that they have 13,428 unfilled positions in the department. Galing na ho sa DOH to, 13,428 unfilled positions with 12,278 vacant positions in hospitals. Bakit kaya ganito, Mr. Chairman, at hindi pa rin napupunan itong mga bakanting posisyon na ito sa dami ng nakatenggang mga health professionals, lalo na po yung mga job orders at contract of service personnel who are facing life and death situations every single day. So with the foregoing, Mr. Chairman, I am here to help. We are here to help in any way we can. We would like to participate actively and secure the welfare of our healthcare workers. Muli, Mr. Chairman, marami pong salamat. Pagpalain tayong lahat ng ating Panginoong Diyos.
Thank you very much. Well said to our Vice Chair, Senator Joelle. It's one of the first to raise these issues even before the pandemic, yung pangangailangan po ng permanent doctors, yung systemic problem po ng ating health system. Isa siya sa mga nauna, if not nauna ho. And dagdag ko na rin po, siya rin po ang isa sa mayakda kasama ni Senate President nung Medical Scholarships Bill. Kasi talagang pinag-aaralan nila yung kahinaan po, yung weak spots, weak points ng ating health system with the hope of addressing it, especially sa provinces. Kaya nilagyan namin ng komite ng pondo after they passed that bill, or even during the passage of the bill while it was going through deliberations. Kami nag-usap-usap na rin kami dito sa Finance Committee na lagyan na natin ng pondo yung mga state universities and colleges around the country, especially those who are ready to roll out their medical program. So with the leadership of Senator Joelle and the Senate President, we put funds in 12 hospitals, Your Honor. So hopefully yun ay ma-release na ho yung pera, and We met with Ched yesterday asking for that, and we told the Office of the President also. So sana yung iba't ibang sangay po ng ating kabinete can work together to make that a reality, Your Honors. No, we'll ask for help also from Health Secretary Duque and the other cabinet members para talagang mabigyan po ng attention ito.
Mr. Chairman,
I'm told
if I
that
may add
yes,
very
go ahead,
shortly, Mr. Chairman.
Vice Chair Joelle. Yeah.
Mr. Chairman, I'd like to spread into the records that without your help, nabaliwala itong Doktor para sa Bayan Law. As you mentioned, when we were discussing it, nag-anticipate na po kayo para kayong MVP ng larong basketball. Hindi pa ho dumarating yung bola, nandun na ho kayo, nakadepensa na kaagad. Kaya maraming salamat, Mr. Chairman. Let me also take this opportunity to acknowledge Senator Bato for his active participation para humadagdagan natin yung pondo doon sa University of Southern Mindanao na ngayon ho, 113 million if I'm not mistaken, nag-start na po kasi there were 10 regions in the country na wala ho ni isang public school offering School of Medicine. This year, nagsimula na ho yung dalawa, magiging 3 po yan, and then another set next year. And we put in, as you made mention, Mr. Chairman, 1.2 billion pesos, additional 1.2 billion pesos for this particular law. So maraming salamat, Mr. Chairman, and we know that this is very timely, needed, because before we pass this measure, 3 doctors attending to 10,000 Filipinos. WHO is saying you need 10 doctors to attend to 10,000 Filipinos. So ang laki po nung gap, and yung 3 doctors na yun, marami nasa NCR, and importante ho talaga na ma-implement itong batas nito. Kaya muli, maraming salamat, Mr. Chairman.
Thank you. Thank you. Very well said. Very well said. Yes, Senator Bato, Vice Chair Bato. Yes.
Yeah, I just would like to correct Senator Joelle Villanueva, Mr. Chairman. Baka hanapan tayo ng pundo ng taga University of Southern Mindanao niyan. It is University of Southeastern Philippines. Baka
Southeastern Philippines,
Yusef.
sorry, my bad. Sorry, Southeastern Philippines. Sorry, it's there. Senator Bato, it's there. Nandun na po at nag-i-implement na sila. Maraming salamat. Thank you. Nakakalito na, Mr. Chairman, being the chair of, you know that.
You have so many
higher
acronyms,
education.
to deal with. Ganyan din ako.
I stand
USP,
corrected.
USM,
Thank you,
USEP. That's a whole alphabet soup there. Thank you to our two very hardworking vice chairs. I'm told Vice Chair Bongo will also make a statement later. See, Senator Tolentino, does he care to make any comments or remarks before we turn it over to the DOH and our other resource persons? Baka wala na po. We'll give them, of course, they will have their time later on. Again, thank you, Your Honors, ladies and gentlemen, for joining us, especially to our colleagues and our health workers, our modern-day heroes. Secretary Duque, I'll give you the floor. Maybe one question aside from the issues we mentioned earlier, sir, is bakit hindi naisama ho ito sa 2022 budget ng pamahalaan? Kasi I was looking at some of the numbers from your office. Parang it's ranging from 50 to 72 billion. Ang lalaki ho ng numero, and yet we're starting from zero. Alam nyo, at our level kasi, we're just realigning . For those who are not too familiar with the budget process, hindi ho kami nag-uumpisa sa scratch ho. Hindi ho blanco yung papel namin. Kumbaga, kung magdadagdag ho kami sa isang departamento, kukunin po namin yon sa isang departamento. Yun ang mahirap. Kaya ang hirap po ng trabaho namin dahil minsan may sumasama ang loob sa amin, minsan may natutuwa, but it is a zero-sum game. That's what I'd like to make it clear. With this money does not appear out of nowhere. We have to take it from another department. So my question, Secretary, is bakit hindi naisama ito sa National Expenditure Program or NEP yung budget po?
Thank you very much, Mr. Chairman. Actually, yung pong pagsumite ng Department of Health budget CY 2022, yung proposal po ng DOH sa Department of Budget and Management last June 4, 2021 was in the amount of 310 billion. And we submitted select proposals for the COVID-19 response na dapat maisama dun sa CY 2022 amounting to 74 billion as an annex to our submission to DBM. Kasi at that time, nung sinasabit namin ito, we were also not certain whether yung Bayanihan 3 ipapasa. Dahil hindi po ba malakas ang usapan noon na sa House, ipapasa nila, at hopefully pati sa Senate. Pero mukhang hindi naman po naipatupad po ito. So, yung nag-propose din kami specifically for healthcare worker benefits, no, for the provision of actual hazard duty pay, the COVID-19 special risk allowance, the accommodation, transportation, meals, and life insurance for 12 months in accordance to the implementation provisions of Bayan 2 Act in the amount of 50.4 billion, Your Honors. So, yung request namin from the DOH is for the DBM at that time to further consider these additional proposals in case Bayanihan 3 or any similar legislative action is not pursued and enacted. So yun lang po. Thank you very much po, Mr. Chairman.
Okay, we'll go back to SEC in a short while. But so you're saying you submitted it to DBM. Who is here for DBM? Andito ba si OIC Tina? USEC Tina? ComSec Director Irene? Is USEC Tina here? Any high official of the DBM?
Director Abella is logged in, but USEC Tina is not. Director Abella from
Yeah,
DBM.
can we ask Director Abella, what's the reason for not including that in the budget of the DOH?
Yeah, yes, sir. Good morning po, Senator.
Morning.
May we clarify, sir, the statement of Secretary Duque? Yeah, we did. Yes, sir. We have a system on the submission of the budget proposal for 2022. Nagkataon lang ho kasi, sir, doon sa submission nila, they did not include that amount of 50 billion from the total proposal na kanilang ginawa. Had it been included, kasi we understand, sir, that that amount was made part of an annex for the information of DBM, which the DOH will be proposing in the Bayanihan 3. Had it been included in the overall proposal as submitted on our online budget proposal, the OPCCB or our bureau to handling all the compensation and allowances should have made recommendations on that part. So hindi naman, sir, namin siya na talagang hindi na ibigay. Nagkataon lang kasi, sir, hindi siya part of the overall proposal submitted by DOH, which should include all the details. Nagkakataon lang, sir, na siya ay ginawa ng as an annex to inform. We interpreted that as information for the DBM that it will be proposed in the Bayanihan 3. So hindi ho naman siya talaga namin siyang hindi naibigay. Nagkataon lang siguro, sir, na hindi na isama ng DOH sa overall proposal na 310 billion.
Okay, that's clear. Well, anyway, don't want to have a word war here, no? Kasi we're here to try to fix the situation. So, ganun pa naman. The statements are clear. You're free to react to that. We'd like to recognize Governor Dax Cua representing the League of Provinces. We also have Director Legaspi of PGH, and we have some officials also from the DOF joining us. Jeremiah Magno, Miss Julie Bato, Miss Vea Cada, and PhilHealth Dr. Risa Herrera. Can we hear from Secretary Duque? Perhaps let's go to the meat of the discussion, which is the benefits, the requirements, and where will we find the money? I think that's the question, because it's a huge amount, and not easy to, as I said, it's very difficult for Congress to remove it from. So perhaps we can try to reconfigure the DOH budget somehow with your help and the help of the legislators. So go ahead, the Secretary Duque, you have the floor, sir, to explain what you think is is a good solution to where we find ourselves.
Okay, thank you very much, Mr. Chairman, Your Honors, and my colleagues from the Department of Health, members of your committee, and fellow public servants. The DOH supports the intent of Senate Bills 2371, 2398, and 2406, which aim to universally accord benefits to healthcare workers who serve at the front lines during the COVID-19 pandemic. The department welcomes the passage of these bills to allow for a more rather inclusive grant of benefits for all healthcare workers serving at either public or private healthcare facility, or whether they are directly or indirectly exposed to a COVID-19 patient. The DOH recognizes that while healthcare workers may be exposed at different levels, they are nonetheless exposed and thus deserving of the benefits accorded to them by law. While the DOH supports the intent propounded by the bills, it, however, proposes that a singular allowance will be offered which will cover and substitute for all the benefits enumerated in the bills. In addition, the rate of the allowance would vary according to the risk exposure of the healthcare worker in particular work settings. If they are, for example, at low, medium, or high risk of exposure. The allowance would be granted in full if a healthcare worker physically reports for at least 14 days in a month. Otherwise, the benefit is proposed to be prorated. The DOH proposed singular allowance covering all benefits with variation per level of risk exposure poses the following advantages. The estimate for this proposal would require 50 billion thereabouts to pay 526,727 healthcare workers the following rates: 3,000 for low risk exposure, 6,000 pesos for medium risk exposure, 9,000 pesos for high risk exposure. I understand that DBM has a alternative proposal with regard to this risk stratification proposal. Number two, the proposal for a single type of benefit allows all health workers to receive the benefit, only that the amount is different based on their exposure. Number three, the proposal for a single type of benefit is easier to implement, as hospitals and other healthcare facilities can be classified into low, medium, and high risk areas, with healthcare workers receiving allowances based on their location within the facility or depending on the type of facility they are deployed to. In addition, the DOH proposes reinstating Section 4K of Republic Act number 11494, which provides for additional benefits for healthcare workers who contract cases of COVID-19. To reiterate, the aforementioned section provides a compensation of 1 million pesos for healthcare workers who die of COVID, 100,000 pesos for those with severe or critical cases, and 15,000 pesos for those with mild and moderate cases. This compensation would require 492,325 pesos in appropriation. Let me just correct myself. 492,325,000 in appropriations for the remainder of 2021, and another 831,060,000 for 2022. It also proposes reinstating other benefits received by healthcare workers under the Bayanihan II law, such as the testing healthcare workers for COVID-19 and the assumption of all medical expenses of healthcare workers in case of exposure to COVID-19, as seen in Section 4J. The DOH submits the following recommendations to the bills with the belief that the proposal is not contrary to the intent of the bills, while also being easier to implement. Annexed to these position papers are our computations for the allowances in Annex A, compensation package in Annex B, the computation for the total number of healthcare workers, Annex C, and the criteria for risk exposure, Annex D. We respectfully submit this, Mr. Chairman, Your Honor, and may I please request that respectfully request the Chairman to please recognize Assistant Secretary Maylene Beltran for a brief presentation of our proposal. Thank you, Mr.
Yes, sir.
Chairman.
Certainly. Thank you, Sec Duque. ASEC Beltran, go ahead, ma'am. You're free to present, please.
Yes, good morning. Good morning po to Mr. Chairman and all our other honorable senators, plus of course our partners and colleagues in health po. So allow me po and then of course the benefits we peg it at 5,000 for SRA, AHDP at 3,000, and meals, accommodation, transportation to be given as allowance for 8,000 pesos per healthcare worker. And then we shall be enrolling them in life insurance. So yun po yung aming mga na-set na rates po for option 1. And that's the basis for the original estimation of 50 billion po. And then option 2.
Bakit ASEC with excuse me, bakit mas maliit po
Yes.
yung number of health workers?
Sir, actually, thank you, Mr. Chairman. That time, binase ho namin yung 365,633 on the April-May na data ho namin on healthcare workers who already have been provided the benefits po. Yun po, sir, yung that's based on the actual data that we have for April and May 2020.
Yan
And then,
ba ang
sir, sa
nag-claim,
option 2,
ASEC? Yan ba ang nag-claim?
yes, sir. Yes,
Okay.
Chairman. Mr.
Okay.
Chairman. Okay, so yung option 2 po, Mr. Chair, we also have assumed that that all healthcare workers, which is now pegged at the 526,727 healthcare workers, because that's the basis of our estimation as we submitted then during to the bicameral committee po way back September of 2020. So nagpeg na po kami doon. We already stayed at that estimation. And if we are assuming that all of these healthcare workers will be provided with all the benefits, we will be requiring 72 billion po or 73 billion with these rates. SRA 5,000, actual hazard duty pay 3,000, and then MAT or meal accommodation transportation 3,000, but to be given as an allowance, and then additional life insurance of 500 pesos. And then, sir, so if we consider that option, we'll be requiring 73 billion. And then yung option 3 po, Mr. Chairman, we also assume that 60% of the healthcare workers, again, based on our data, 60% of the healthcare workers, again, of the total of which will be 526,727. If this all 60% of this will be provided with SRA and MAT, because we are assuming that they are directly catering and giving treatment and support care to the COVID patient, given the same rates as option 2, we will be requiring a budgetary amount of 52 billion. And then,
Palagay
sir,
ko,
we also...
may konting detail dyan na mali, ASEC, yung number of HCWs. Sapagkat pag minultiply mo ho yan, you will get more than 52 billion. Siguro, kasi nakalagay yung assumption is 60%, but it still says that the HCW number is 526,000. It's probably not 526,000, ho? Di ba?
Yes, sir. It's just 60%, sir. Sorry po. Hindi na namin na-correct yung slide, Mr. Chairman.
60% is much lower. Yeah. So it should...
Yes, sir. Okay,
Pakicorrect
sir.
na lang, pakicorrect na lang ho for the benefit of the
namin,
public.
magaling sa ganyan yung chairman namin.
Thank you very much po.
May kopya kasi ako na tama, so magaling ako mag-compare.
Okay, sir. Thank you po. Thank you po, Mr. Chairman. We'll correct that po. And then yung option 4 po, yes, sir. Ang option 4 po
I have a
is...
question on option 4 na paliwanag nyo na tsaka ni Sec
Yes,
Duque
sir.
kasi I want to
Yes,
keep
sir.
the discussion flowing. ASEC, pasensya
Yes,
na po.
Yes, sir.
Have you done the numbers? Ilan po yung sa low risk, ilan po yung sa medium risk, ilan po yung sa high risk?
Yes, sir. Again, let me show the more detailed slide, sir. Mr. Chairman, pasensya na po, it will be a bit crowded slide, pero I'll show the computation po.
Opo. It's still, what I'm asking is how many would fall into the low risk of the 526,000 or so healthcare workers? Ilan po yung low risk? Ilan po yung medium risk? Ilan po yung high risk?
Sir, while I'm waiting for the slide, sir, ito po yung percentages na nakita namin. Yung low po, out of the 526,727, there will be 6% only. Yung total of the total. And then the medium risk, there will only be 7%. And then yung high would be, of course, 87% of the whole 526,000 po. Yun po. So 6%, 7%, and then 87% po.
Yeah, we can do the math later. Thank you.
Yes, sir.
That's good enough. Go ahead, Ma'am Aseng.
Yes, sir.
Please continue with your presentation.
Okay, sir. Sir, I need not flash anymore the details of this table unless
Hindi na siguro kasi ulitin na lang natin 6% for low risk, 7% for medium risk, and 87% for high risk. And the base number is the 526,000 health workers. Tama ho ba?
Yes, sir.
Okay, thank you.
Yes, sir. Thank you po. Sir, the last 2 slides will just allow us to see that the 50.4 billion will just entail or will just be covering the benefits. However, we know, sir, that there's an additional compensation for those who got sick and who died. So, kung isasama pa rin ho natin yun, Mr. Chairman, ito na ho, kasama ang estimated amount of around 831 million, magiging yung 50.4 billion ho natin, magiging, yung option 4 na lang po ang tinitignan ko, 51 billion po to cover also the compensation estimates po. And then, sir,
compensation
yes,
aspect, that subsists di ba? Hindi, legally speaking, hindi naman nag-terminate yon sa ilalim ng bayanihan because and that was settled
yes,
in the hearings we had. So dapat separate ang treatment yan because yan dapat manggaling sa inyo yan. It's not a new appropriation, di ba? It is a continuing appropriation. Whereas yung yung sinasabi yung 50 billion, that is a new appropriation that we must look for money. Pero yung 800,
Yes, sir.
dapat nahanapan nyo na yan dahil nasa batas na yan and it subsists, di ba? Tama ho ba?
Yes,
At least for
yes, sir.
yung remaining 400 plus billion for the remainder of 2021.
Yes,
Yung
sir.
2022, kung wala yan, yun ang hahanapan namin, di ba?
Yes, sir. Tama po, Mr. Chairman.
Yeah.
Thank you po.
Let's just be clear about that para walang mabuti na sumobra kaysa kumulang is my point, basically.
Yes, sir. Sir, the last few slides will just again inform everyone that next please, that these benefits, for example, the one-time COVID allowance would just be on top of all the benefits being received by our public healthcare workers under the Magna Carta law po. So therein, we know that public healthcare workers are already receiving hazard pay, subsistence allowance, laundry allowance, longevity pay, automatic one salary grade higher 3 months prior to retirement, and then salary increase po. So I think, Mr. Chairman, thank you for the opportunity, Secretary. Those are my slides. Thank you po.
Thank you for that, Asek Beltran. Anybody else from the DOH before we turn it over to other departments like the DOF and the DBM? We'd like to acknowledge Vice Chair Senator Dick Gordon. I see him on the screen. He's the author of the measure and also on top of a lot of health issues as chair of the Philippine Red Cross. So we'd like to acknowledge him first of all. Vice Chair Gordon, good morning, sir. You have the floor, sir, for any remarks you wish to make.
Good morning. I just have to make a preliminary remark, and this is, if I may. Good morning, Senator Angara. Good morning, everyone.
Morning, sir.
My fellow senators.
Good morning, Mr. Senator. Good, Vice Chair.
This position is made by this representation along with Senator Angara, principally, and Senator Hontiveros, who wants to be a co-author, and all the others, principally because you do not send to war your soldiers without having the proper protection. We provide PPEs, we provide masks, but on the other hand, when they get wounded, they have to come out with support that is assured them. Otherwise, you may have a very, very limping, intervention insofar as COVID is concerned, and that could break down the health system if so many people just walk out or would not want to do it because it's too much risk. There's already risk on their part, but also with their families, and that is why we propose this. And I'm going to listen, Senator Angara, for the proposals. I'm sorry, I got in a little late. Had a long night last night, and I would like to listen and take part in the discussion later on. Thank you very much.
Thank you very much, Senator Gordon. Basically, to recap, the DOH is proposing a simplified form of COVID allowance based on 3 categories: low risk, medium risk, and high risk, to cover the over 500,000 health workers in the country. I think the argument, if I'm not mistaken, is for ease of administration. And the bulk will be getting the high risk category, which is low risk gets 3,000 a month,
Yes.
medium risk gets 6,000, and high risk gets 9,000. And those in high risk are 87% of the 500,000 or so. Medium risk is 7%. They get 6,000, and low risk gets 3,000. Could you flash, for the benefit of Senator Gordon, the categorization of low, high, and medium? So at least makita po niya. And we'd like to also acknowledge the co-authorship of Vice Chair Risa Hontiveros and Vice Chair Amy Marcos to our bill with Senator Gordon.
I think I was able to cover that part.
You caught that, Your Honor.
And I saw it last night.
Thank you.
And,
Thank you.
I don't want to waste the time of the committee because this is very urgent. And
Thank you very much, Your Honor. We appreciate that.
Are waiting for this. Thank you.
Yeah. Anyone else for Sec Duque from the DOH who wishes to speak before we turn it over to the other departments?
We're okay, Mr. Chairman. Thank you for the opportunity.
Thank you. Salamat, Secretary Duque. We'll turn it over to the DOF because I think this is Vice Chair Joelle, please go ahead,
Yes,
sir.
Mr. Chairman, I think our chair might have forgotten that I intend to co-author this measure, Mr. Chairman, just to place that on record.
Thank you.
Thank
Thank you very much for
Chairman.
manifesting that, and that is a most welcome support from.
Was that Senator Gatchalian, Senator Angara? Or?
Is that Michael Jordan,
Yeah.
Mr. Chairman?
Thank you.
It's Flash.
Jordan
It's
or
Flash
Luka
Gordon.
Doncic?
Thank you, Your Honors, for the support. So we'd like to turn it over to, because of the nature is really sourcing the money, I think is the source of the problem. Since it's not provided for in the 2022 budget, we have to be creative in finding a solution here. Can we ask DOF what their suggestion is with respect to this? As you know, we're also constrained by the Constitution. We cannot add to the total of the President's budget, no? We can only realign. So yun ang sinasabi ko po earlier. We cannot, it's very difficult to make 50 billion materialize out of nothing. We have, if ever, we have to find, we need your help, the help of the body in sourcing these funds within the 2022 budget. Or if not, maybe there is an alternative financing scheme that our authorities can think of. That's why we'll ask the DOF, who can speak for the DOF?
Good
I
morning,
think
Mr. Chairman.
Mr. Chairman,
This is
just
Director
before
Brion. Director
can we ask
Brion.
the representative of the healthcare workers to speak, because they are the ones who are really have to be heard here. We cannot decide without.
Yes, we'll recognize them after the DOF.
All right, okay. I just
Senator
wanted to
Gordon.
make sure that we heard them. Thank you. I see
Certainly,
Mr. Mendoza there and all the other leaders of the group. Thank you very much.
Certainly. DOF, who was speaking earlier?
Mr. Chairman, good morning for the Department of Finance. I'm Director Valerie Brion.
Yeah, go ahead, Director Brion, please. You can skip the formal. Can we ask the resource persons to skip the individual greetings na lang? Just to proceed with the meet. I'm sorry not to dispense with good manners, but really to push these things along, kasi we only have till 1 o'clock, and then we have the bill of Senator Bato for Marawi compensation, which they've been waiting for many years also. So go ahead, Director Brion.
Thank you, Mr. Chair. I will go to the meat of our comments on the bills. First, we are a bit concerned about the foregone revenue because our initial estimates show that it will result in a revenue loss of about 5.6 billion. But this is also very conservative given the limited data that we have at the moment. In terms of general tax principles, I think we've consistently raised also concerns over granting tax exemptions to very specific sectors. In lieu of our train law, where we sought to simplify and broaden the tax base, we already adjusted personal income tax exemption thresholds to provide relief for low-income workers in all sectors. And as a result, due to the adjustment in train, the proposal to grant tax exemptions here will actually favor high-income health workers, since under the tax code, the holiday pay, overtime pay, night shift differential, and hazard pay, they're all already exempt for minimum wage earners. In terms of the providing funds, we usually prefer, Mr. Chair, that the budgetary process be followed instead of automatic appropriation provisions so that Congress may efficiently allocate our scarce resources. In terms of providing creative solutions, Mr. Chair, we will continue to work with the committee and provide the usual support in computing for the estimates. And we will also be clearing this with our principals. For now, that will be our comments, Mr. Chair, and thank you very much.
Thank you. Siguro, pag may savings, i-allot na natin for the health sector. Yun ang naiisip ko. So we don't have to rely purely on the 2022 appropriations. Maybe we can talk to UNDBM about that. Of course, it's only the president who can realign the savings of the executive branch, no? Pero I'm sure he will listen to your suggestion on this matter. That's one thing I'm thinking of, no? So just putting that out there. Now, per the suggestion of Senator Gordon, we'll now hear from the health workers. We'll first hear from the National Confederation of Barangay Health Workers. President is Zenaida Pulido. Then after, we'll hear from the Philippine Nurses Association, and then the Alliance of Health Workers. So can we hear from Ms. Zenaida Pulido, the National President of yung Barangay Health Workers po ng Pilipinas. Yes, ma'am. Opo. You're recognized ho, ma'am. Pwede na hong magbigay ng posisyon ninyo.
Good
Opo.
morning, Mr. Chairman. Magandang
Opo.
umaga sa inyong lahat po. Polido is speaking, the National BHW President.
Medyo mahina ho, ma'am. Pwedeng pakilakas ho.
The National President of the Barangay Health Workers, sir. Seni Polido, Sanayda Polido from Lucosur. Sir, our concern, no person duly accredited as a BHW shall be removed except for a valid cause to be determined by the local health board, provided that if a BHW is found to be unjustly removed from service, he shall be entitled to reinstatement without loss of benefits and incentives from the time of his termination up to the time of his reinstatement. Lalo na ngayon, Mr. Chairman, maraming report sa akin na yung mga barangay captain ay tinatanggal na yung mga dating barangay health worker na nagbo-volunteer noon hanggang ngayon. Number 2, in recognition of BHW services and to aid them to perform their duties, all BHWs who are actively and regularly performing their duties shall be entitled to monthly honoraria in the amount of not less than 3,000 pesos, subject to adjustment based on the prevailing market value. Number 3, sir, sa hindi pagtanggal ng mga senior citizen unless they can do their duties. Because sa akin, I've been 43 years as president of the Barangay Health Worker from the municipal, provincial, regional, and at the same time, being the national president. Hindi ako naghahanap ng anuman kung hindi lang gusto kong makatulong sa mga BHW kasi sila ang kasama kong nauna na nag-volunteer, mga senior citizen. Ngayon tinatanggal yung mga senior citizen. Alam ko na mas marami kami pang senior citizen ngayon na tumutulong at ang mga senior citizen ngayon na katulad ko, wala kaming tinatanggap noon, gusto nilang makatulong sa mga tao. So, please, Mr. Chairman, mga honorables, tulungan nyo kami as barangay health worker na volunteer na hanggang ngayon. Marami pang positive at saka mga negative na kasama ko. Meron nang namatay. Awa ng Diyos, hindi kami natatakot na humarap, na tumulong kung kailangan kami ng mga tao sa barangay namin. Sanay na kami. As I had said, I've been already 43 years old as president and I am 74. Gusto ko lang makatulong sa mga tao. Please lang, tulungan nyo ang federation namin. Maraming salamat po, lalong-lalo na ngayon sa pandemyang ito. Thank you, Mr. Chairman.
Salamat din po, Ms. Zenny Pulido, representing our barangay health workers. Salamat po sa inyong kagitingan, especially sa ating mga senior citizens. Can we now hear from the Philippine Nurses Association? We have President Reyes and Ma'am Zenny Concepcion. Are you here, President Reyes?
Yes, Mr. Chair, thank you po.
Yes, President, go ahead, sir.
We have a manifesto entitled Unjust Struggling Healthcare Workers in the Year Within the Pandemic. The nursing community honors the sacrifices Filipino healthcare workers have made in service to the people. While the pandemic has ravaged economies, governments, and societies, some have pledged their lives, time, resources, and personal space to help people in need of medical care. Filipino healthcare workers, including nurses, have once again proven their worth and value. And as they volunteered to help rebuild communities, their efforts have laid the cornerstone of bayanihan, hard work, solidarity, trust, responsibility, and unity. While their sacrifice is overflowing, nurses' rights and welfare must be respected at all times. With regards to rights, the collective rights are etched in the annals of laws and welfare policies. And for a long time, Nurses as workers have liberally exercised them. The rights to have a decent wage, to work, to have a fair and just working conditions, to form and join trade unions, among others, are assured by the 1987 Constitution and various laws. With regards to their welfare, much work remains to be done in order to fully give flesh to social legislation, as nurses' experiences show. The present pandemic is the best example of how governance should address welfare concerns of nurses. A year has already passed, and an effective response against the pandemic is still nowhere in sight. Most nurses have yet to receive the same. It has been a year since the two Bayanihan laws were enacted, yet the money owed to nurses remains to be distributed. Meanwhile, nurses continue to become vulnerable to COVID-19 without being fully compensated for their efforts. Healthcare workers are not expendables, nor can government assume that there will always be fusillade of heroes who will fight its war against the virus. If the goal is to get back to normalcy, our government should give healthcare workers their much deserved respite from suffering. Being humans capable of feeling emotion sets them apart from brute entities. Our leaders need to put in mind that decent wages, reasonable working condition, and recognition of dignified existence support the healthcare workers' oath of duty. But if the government continues to exploit its people, then it's committing an atrocity that can never be countenanced. Mr. Chair, we are supporting a compensation and benefits for all health workers, katulad po ng ayuda sa bayan. Sana ganun din po na hindi komplikado yung pagbibigay ng ayuda para sa ating mga healthcare workers. Maraming salamat po, Mr. Chair.
Salamat, President Melbert Reyes of the Nurses Association. Tama lang na purihin po natin ang ating mga nurses at health workers. Next is the Alliance of Health Workers. But before I recognize him, after him, we will go to the Philippine Medical Association and the League of Provinces, the ULAP, the Union of Local Authorities of the Philippines, and then the Filipino Nurses United. So pakihanda na po yung susunod. Now we recognize Alliance of Health Workers, Mr. Mendoza. You have the floor, sir. Nakamute ho kayo, sir. Nakamute ho.
Okay. Hello, sir. Okay na po.
Okay na. Thank you.
Okay. Sige, sir. Good morning, Mr. Chair, at sa lahat ng ating mga batas sa Senado at the same time, yung ating mga resource speaker at kasama din po ang ating mga officialis ng Department of Health. So ito yung position paper po namin. Gusto ko lang basahin. Lang po ha. Sige po. The position paper of the Alliance of Health Workers. Ayun, wait lang pa. Sige po. For the Senate Bill number 2371, Senate Bill number 2398, and Senate Bill number 2406. In recognition of the invaluable role of the health workers, the Alliance of Health Workers, which is composed of unions, chapters, and individual health workers, both public and private nationwide, welcomes the Senate Bill number 2371, or COVID-19 Benefits for Health Workers Act of 2021, introduced by Senator Richard Gordon and Sani Angara, and Senate Bill number 2398 and Senate Bill number 2406, or Allowances and Benefits of the Healthcare Workers Act of 2021, introduced by Senator Christopher Lawrence Bongo and Senator Ronald Bato de la Rosa. HW, the Alliance of Health Workers, strongly believes that the crafting of these two bills from the Committee on Finance, Ways and Means, and Health and Demography was directed, inspired by the health workers' unity and strength as we persistently struggle for our rights, safety, protection, and welfare. We, however, commend the senators for hearing the just demands of all private and public health workers who have risked their health and safety in battling COVID-19, a deadly unseen virus. These bills are indeed a product of health workers' determined and committed fight during the time of pandemic. HW is specifically giving due credit to the Senate Bill 2371 as the bill defines more its coverage relative to what HW demanded and continuously asserted. Number one, benefits shall be provided to all public and private health workers regardless of status of employment. A well-defined public and private health workers was provided in the said bill. Benefits should be continuously provided even after the lapse of Bayanihan 2 and until the state of national public health emergency declared by the President remains in full force. Retroactive application of the provision from July 1, 2021 was set. SRA and active hazard duty pay shall be provided in addition to existing benefits being received by the health workers under existing laws. Number four, provision of the life insurance, meals, accommodation, and transportation allowance regardless of the community quarantine status. And then number five, tax exemption of the benefits received. And then likewise, we are also giving due credit to the Senate Bill 2398 as the following response to the HW calls defines, number one, defines SRA as a fixed monthly COVID-19 benefit and an addition to Republic Act 7305 or the Magna Carta Public Health Workers Benefit. HW strongly opposed the provision of SRA through a prorated scheme as it denies the health workers who are on quarantine due to COVID-19 exposure to acquire the said benefit. Number two, defines provision of the active hazard duty pay as a monthly and as an additional benefit to hazard pay granted under 7305, and that active hazard duty pay is exclusively provided to public health workers. Provision of the life insurance, meals, and accommodation and transportation allowance of their cash equivalent. However, aside from above-mentioned provision that we approved to, HW reiterates its call for the provision of the following. Provide a special rest allowance of 5,000 per month, not prorated to all public and private health workers, regardless of employment status. Number two, provide active hazard duty pay of 3,000 per month, not prorated to all public and private health workers, regardless of employment status. Active hazard duty pay shall be in addition to the hazard pay benefit under the Magna Carta Public Health Workers. Number three, provide life insurance, meals, accommodation, and transportation allowance provided as cash to all public and private health workers amounting to 38,000 per month. Number four, provide the COVID-19 compensation 15,000 for mild and moderate cases, 100,000 for severe cases, and 1 million for the death compensation. Compensation for mild, moderate, and severe cases shall be provided every COVID infection the health workers is diagnosed of. And along with this provision of this COVID-19 benefits, we are sincerely asking your good office and committee to review and prioritize the appropriation of about 2 trillion for health in the 2022 budget so as to address the problem of acute understaffing in the public hospitals, provision of quality and comprehensive health care, and effective COVID-19 response. With the prioritization of the health in the budget of 2022, eventual collapse of our healthcare system will be prevented. We hope for your favorable stand for the good and the majority of the people and for the health workers' safety, protection, rights, and welfare. Maraming salamat po.
Salamat po, Mr. Mendoza from the Alliance of Health Workers. Can we now hear from the Philippine Medical Association? We have President Atienza and Dr. Dazo. Your Honors, are you here? Nandito ba si President Atienza?
I'm here na po.
Yes, go ahead, President. Yeah.
Good afternoon po. Thank you to our chairman, Senator Angara.
I'm sorry to interrupt, President Atienza, no? Pero can we ask the resource person, pag-aralan sana nila yung proposal ng DOH for the prorated, yung not prorated, but the risk-based allowance. Because
Yes,
according to them, it's very easy to administer. So kung wala pa kayong position at this time and you have to consult your members, please make sure na lang that you will have a position before we can finalize the committee report. We'd like to acknowledge one of the leaders of our chamber, our dashing, mukhang artistahin po na majority leader natin, the majority leader, Senator Mig Zubiri. Morning, sir.
Good morning, Chairman. Good morning, Senator Joelle, to my dear colleagues. Senator Bato is there, Senator Gordon. We're here in support of the measure of Senator Gordon and yourself. I promise that once we get it out on committee level, we will give it utmost priority dun sa atin sa plenaryo. Pasensya na lang na late ako. Nakikinig ako sa isang committee, hindi pala yun yung committee mo. Nagkamali yung staff. Committee ni Amy, Civil Service Budget Hearing pala yun. Ang tagal-tagal ko nakikinig. Sabi ko, ba't walang ano dito? Ba't
Walang
walang
health.
medical workers? Mali pala tong staff ko. Ibang room, VT room pala tayo. So, pasensya na lang, Chairman, I'm late. But I'm here in full support. Better late than
Your
never.
attendance is most welcome, Your
Fully
Honor. And
support
alam niyo po, pag si Majority Leader at si Senator Joelle po ang nagsuporta, yan po ang tag team sa Rules Committee. Mapapabilis po ang ating panukala ng dahil sa dalawang magagaling na mambabatas na yan. Pasensya na, President Atienza, for the interruption. Go ahead, sir.
Again po, thank you, Senator Angara, the chair po. Sana po hindi ko po attend kasi personal pong tumawag yung secretary nyo kaya po pinilit ko po mag-attend.
Thank you.
Kahit po Medical Association. As you know, the Philippine Medical Association is just celebrated our 118th Foundation Day. Kami po pinatandang for just the record po. And now we are celebrating the 64th Medicine Week. And for the past years po, mukhang nakalimutan na po ang importansya ng mga doktor sa ating bansa. And we do hope na sana po, like here in Senate, pinakikinggan po kami. Sana po, sabihan po naman ninyo in lower house that the doctors po, pag inimbitan na, huwag na po nilang pagagalitan. Ay isa sa pinagalitan at parang ini-invite po kami doon as resource speaker. Pagdating po namin doon, kami inimbestigahan. Tama po ba yun? And sana po, this time, ang dahil po nagalit na mga doktor namin, this is parating po lang natin. Na for the past years po, wala pong ibinigay na mga proclamation ang ating pamahalaan. Pero yung huli po ay pinagdiriwang Physicians Day on September 27. Sana po naman, hindi po kami mga doktor nagtatrabaho, hindi po labas sa kompensasyon. Dapat po malaman yan. Ang kailangan po na namin is itayo po natin ang bantayog ni Rizal na kaya po siya, di ba, national hero natin. Ano lang po namin, hindi po namin inaano yung sa compensation, kahit po wala compensation na hindi po nare-receive. Sana po magkaroon po ang Senado na isang statement lang po or na ipagdiwang po natin ang Physicians Day sa 27. Iyan po ay 1978 pa. Hindi po nabibigyan ng importansya ang mga doktor. Dito po sa pandemic, kailangan po namin moral support from the Senate and the lower house. Huwag po kami pagagalitan. Yun lang po ang natin for the record. Kasi ang dami pong nadidismaya na po sa pag po sa amin. Then, like in different government po, kami po ang vulnerable dito. And we just during this vaccination rollout, kami rin po hindi po mag-ano po ang vaccination center, ang site kung walang doktor. Kami po nag-i-screen. Kami po ang nagmo-monitor at kami yung vaccinators din. And ang dami pong health workers ang nahahawa pa rin even may vaccine po sa vaccination center. Siguro po, extend po natin ang ating compensation, hindi lang po yung nasa hospital, but in outside. Like, we should, yung Magna Carta of the health workers, dapat i-revisit po natin. Kasi yan po ang battle cry of the health workers. And regarding the barangay health workers, how can magpa-function sila kung yung mga health workers po natin 300 lang binibigay ng LGU, 200. Yun po pag mag-e-election lang nare-receive. Paano sila magpa-function? And regarding po sa mga compensation of the doctors and can we na hindi na po dumaan sa LGU and the Senate can provide po the list of nabigyan na po ng mga benefits, hazards pay kasi po different regions and different hindi nila natatanggap po talaga. And this time of pandemic, marami naman doktor ang hindi po hindi na po nagki-clinic, they stay at home. Siguro po yung ating telemedicine paigtingin po natin, dapat i-compensate din po yon yung hindi those who are involved in the community projects. And sana po isama yung ang sa compensation yung like sinabi kanina, dapat may mga po yan para makiinganyo tayo. And one of the things nahihirapan yung new doctors natin is regarding PhilHealth. We cannot have PhilHealth accreditation po. Hindi po naman yun, PhilHealth is is ano po, privilege lang, pero we must be member of PhilHealth. Paano po naman makakaano po ang mga doktor natin kung 68,000 in 3 years ang babayaran ng isang doktor na bago nagpa-practice? And nasa law po yan, kayo lang po makakapag ano po niya, na sana po bigyan ng leeway yung mga doctors, even this trying times, wala silang pambayad ng PhilHealth, bakit hindi po natin i-accept muna sa PhilHealth as one of the ano po, one of the benefits po, including sa package. Kasi yung package nga po hindi nakakarating, at least yung PhilHealth, kung pwede po pong i-suspend muna ng ano po for the health workers, kasi isang balakid din po yan. Kaya hindi po yung ibang doctors hindi maka-function. Kasi kung hindi sila tatanggapin sa hospitals, kung magbabayad muna sila ng PhilHealth. Yun po, at saka ang request po namin, sana hindi na nga po dumaan yung mga benefits, yung mga hazard space, si LGU, katulad po ng SRA, dumadaan po yan. And hindi po talaga, marami po mga health workers nagre-resign kasi hindi nila natatanggap ang kanilang mga benefits. Meron po, maganda po yung bill namin po, kaya lang po yung implementation and how can they reach to the sa beneficiaries po natin. And that's one of our reason po. And as of now, kulang na po tayo ng mga doktor sa mga ibang ano po, dapat binibigyan po siguro ng yung direct allowance, direct po yung weekly, monthly dapat na check po kasi ang dami na pong ano po, lalo yung mga municipal health officers po natin, like here in Batangas, how many municipal health officers po ang namatay dito? More than 5 na, in Batangas lang po yun. Ang dami po namamatay. Yun lang po, and we will we will give our official position paper po regarding this. And thank you very much po for the Senate for giving the this time para po mabigyan po ng more benefits ang ating health workers, hindi lang po ang mga doktor.
Salamat po, President Atienza. We assure you we will listen to your concerns. At saka walang magagalit sa inyo dito. Alam niyo bakit? Kasi nag-log out na si Senator Gordon. Kaya wala na magagalit sa inyo. joke lang. Anyway,
Senator Gordon.
Hindi
ayos
naman.
dyan,
Oo.
dyan para po siya.
I find that offensive, Senator Angara. Please don't joke about that.
Sorry.
You want to follow President Duterte, you can do that. But you know, this is a Senate that has to be respected. And I never gotten mad at anybody unless they lie.
I agree.
Let's not joke about that. That's not a joking matter.
No offense intended, Your Honor.
I took offense because I think, especially since this doctor is complaining, because they probably complained because when they walked out of the hospital, they were berated by some of us, not me.
Yeah, for the record, walang pinagalitang doktor po si
Binerate ko
Senator
sa
Gordon.
Blue
Pinagalitan po niya
Sinungaling.
yung testigo na hindi sumasagot na maayos.
Sinungaling, hindi makakasalanan. Ito na nga, naghahanap tayo ng pera. Ang dami-daming perang nilus tayo dyan sa PhilHealth. You know, you keep joking.
Yeah, no offense, Your Honor. No offense intended. Just trying to keep things light. Thank you.
No.
Pasensya na po.
Not at my expense, please.
Thank you, sir. We'd like to recognize Vice Chair Amy Marcos. She's who joined us and who's kindly co-authored our measure with Senator Gordon and Senator Risa Ontiveros. With your indulgence, ito kasing taong to very busy, si PGH Director Legazpi. Can we hear from him? Halos every 30 minutes may operasyon ho ito kaya siguro we'd like to give him crack with the indulgence of some of the resource persons kasi you know PGH is an extremely busy hospital. So Director Legazpi, sir.
Magandang umaga po sa inyo lahat. Thank you for giving us this opportunity, Mr. Chair. I hope, I think I will be speaking for the rest of hospital administrators who are actually in the trenches fighting this war of COVID. I take special note of the proposal of the Department of Health. It's a welcome development for an administrator like me, and probably I speak for others also, because if I give you just a background on what happened with the previous SRA and MAT issues, when it first came out, we were ordered, we followed the circular stating that SRA be given to those directly catering to and caring for COVID patients. So when we did that, rinali po kami ng mga hindi wala sa COVID wards kasi po ang mga hospital na hati yan eh. May nagko-COVID, merong hindi. At hindi na po naghahalo sa karamihan ng hospital. Nung pong binigay naman namin po, no, dahil nga mo may directive na ibigyan lahat, nagalit naman po yung mga nasa COVID wards. And I think they have all the right to. No? It's not only the risk exposure that I think we are compensating. It's also the kind of work that they do. They actually cry with every patient that dies. No? And if patients die, there was a day that 21 patients died in PGH because of the very difficult cases that we get here. And you can imagine what emotional trauma that brings to a nurse or a doctor. No? Hindi na po nila kino-complain yung trabaho. Yun lang hong hirap talaga ng hindi sila makatulong sa pasyente. So I think we really welcome the proposal of Secretary Duque to appropriate the allowances based on the not only the risk, no? As I said, in addition to the work they do as COVID direct care healthcare workers. No? And again, from an administrative standpoint, consolidating all of this into one simple allowance if I may just do some number crunching, in the previous SRA, they used to get 227 pesos per day for a 22-day month. Now they'll be getting 409, these COVID workers. No? And that's higher than the non-COVID workers that will be working. And I think this will be really equitable to the work that they do. So we really support and welcome very much this development of stratifying the risk, the allowance based on risk, and also on the work that they do. So this will give us a more constant and predictable manner of disbursing these allowances. And of course, the healthcare workers will also be happy to be receiving a constant allowance. And I hope for the COVID workers, if I may make a suggestion, that we compensate them for the whole 22 days. Because COVID healthcare workers actually are mandated to take longer breaks because of the difficulty of their work. So if we just go by a daily time record reporting, naturally they will have less days reporting than the non-COVID workers, or especially the office workers who can go to work every day because they don't get as tired as the COVID workers. No? So if I may add lang po for even more appropriately, I think the COVID direct care and catering to patients rightfully should get a higher allowance and compensation, and should be paid fully for the 22 days that they serve per month. I think that's our position in this, and I'd like to thank the Senate and the Department of Health for allowing us to comment on this proposal. Thank you very much.
Thank you very much, Director Legaspi. Yes, Vice Chair Villanueva. Go ahead, sir.
Yes, I will just be very quick, Mr. Chairman, with the indulgence of our distinguished colleagues. I just wanted to maximize the time of our Director of PGH, Dr. Gap. Mr. Chairman, I have been listening attentively from the very start. When I did my opening statement, I made mention about my computation, the numbers that I was looking at, especially in doubling the SRA and hazard pay. And then we listened to DOH, their presentation. You made mention several times yung pong low risk, which is 6%, medium 7%, high risk 87%. I was listening to Doc Gap kanina, and he was mentioning, yeah, it's okay, no? But if I may just ask one question, just to be clarified on this, because I think the determination of risks depends on the surges, Mr. Chairman. So, which may be unpredictable. So perhaps if we have this low, medium, high, yung binabanggit ni Doc Gap, yung isang healthcare worker, dalawa yung ina-attenda niya. Kung tumaas yung surge, maging tatlo na ho per healthcare worker. So ang point ko lang, Mr. Chairman, is that we need to make sure that we take into account consideration of these unforeseen circumstances when we calculate the figures, Mr. Chairman, just to put that on record, and I wanted to hear sana kay Doc Gab, what would it be? Kasi even if I wanted to support yung low, medium, high, parang hindi po, I'm not sure if I would agree with the basis of determining that risk, because I believe that it would depend on the surges. Itong Delta variant, wala naman din po itong pinipili. Hindi din natin alam na darating po ito. That's just my point, Mr. Chairman. Thank you, Mr. Chair.
Yeah,
Thank
it's a
you.
good point. Again, Director, would you like to respond to the
Yes.
point of Senator Joelle?
I think po, that will be very difficult to do on a daily basis already. On a practical basis, I think the healthcare workers serving in the COVID wards just being given a straightaway 22-day credit for whether they report to work or not, because they have to rest the rest of the month, I think will be a big boost already to this, even if they work a bit harder on some days.
Okay, thank you, Director. The points are well taken, and it's part of the calculus when we eventually finalize the measure, Your Honors. I'd like to extend my apologies to our Senate Blue Ribbon Chair, Senator Gordon, for my remark earlier. I hope he forgives me. I realize in retrospect it was quite ill-timed given the current events and what the Senate is investigating. So my apologies, Chairman Gordon.
Thank you. I just wanted to make sure that the Senate is well protected and insulated from unnecessary remarks by the Chief Executive. We have never berated anybody without justification. And if people do not want to protect our countrymen, we have to stand up on the plate, and we cannot allow the Senate to be the punching bag of anybody, particularly the President, who has no business telling us what to do in our country, because the Senate is the counterbalance for abuses in this republic. Thank you very much. I just made that remark in behalf of the Senate and in behalf of the friendship I had with your father, and we never had any sore things to say about each other for a long, long time. Thank you very much.
Thank you very much, Senator Gordon. My apologies again. Can we now hear from the Philippine Nurses United? We have President Abenohar and Ms. Jocelyn Andamo. Are you online?
Mr. Chairman,
Yes, Vice Chair Bato de la Rosa. Yes, go ahead.
just a short rejoinder doon sa statement ni Senator Villanueva.
Yes, please go ahead. But just a reminder, we have an hour and a half and some resource persons, but we'll allow these short interjections. Go ahead, sir.
Very short lang, Mr. Chairman.
Go ahead, sir. Go ahead, please.
Yung pag-classify natin into high risk, low risk, or mid-risk sa mga health workers, Mr. Chairman, gusto ko lang sana i-share yung aking experience sa military at sa police. Yung aming combat pay, naka-fix yan. Pag sinabi mong 720 pesos for combat pay, ma-expose ka man sa matinding gira or mahina na gira, you are fighting NPA, you are fighting MILF, or you are fighting fighting Mindanao, you are fighting Luzon, you are fighting in Visayas, pareho lang po yan. Pag sinabi mong combat pay, fix yan. 720 pesos per month. So, I just would like to reinforce the point being raised by our very hardworking colleague.
Joelle. FNU, if they're not here, we'll go to...
Sir,
Andyan na po kayo.
here.
Okay, ma'am.
Yes,
Yes, President Abenohar. Go ahead, ma'am.
Okay, magandang umaga po, Mr. Chair and Mr. Vice Chair, Senator Gordon, and to all our resource persons as well. Basahin ko po yung maikling position paper ng Filipino Nurses United. The Filipino Nurses United, or FNU, commends the Senate Blue Ribbon Committee in pursuing the investigation of irregularities in DOH transactions or spending of funds at this time of pandemic based on the COA report. The Filipino nurses, comprising 71% of our nation's health workforce, according to the World Health Organization, are hardly hit by this coronavirus, being top on the list of 24,091 infected health workers, according to the Department of Health as of September 9 this year. FNU deeply regrets the suffering and lives of our health workers at a time that it could have been prevented if only there's much quality and appropriate personal protective equipments at their workplaces. who then would be accountable for this suffering and lives lost on the part of the health workers. In relation to the issues of SRA and other Bayanihan 2 benefits compensation, FNU have been closely monitoring, and we will provide you a list of health facilities which until now have not received these benefits. FNU views the Senate Bill number 2371, which is being proposed by Senators Gordon and Senator Angara, as very relevant to immediately address the restrictive provisions of the Bayanihan 2 law. We agree that all healthcare workers, medical and non-medical health workers, regardless of employer, public or private, and regardless of status of employment, whether they are regular, they are on a casual basis of employment, contractual, job order, contract of service, or outsource. They all deserve the COVID-19 benefit and compensation during this period of pandemic. FNU also agree that the active hazard duty pay of government sector should be given to government health workers on top of their existing hazard pay under the Magna Carta of Public Health Workers. At this point, Mr. Chair, I'd like also to seek the clarification later by the Department of Health as to the basis of the 527,727 health workers. Because in their previous press releases, Secretary Duque has been mentioning about 1.8 million total health workers. So we would like to be clarified why or how they came about this 500 plus health workers. We would also like to know if this includes our health workers in local government units health facilities, because they are mostly the ones who receive either delayed or are not receiving the supposed to be benefits under the law. We also would like to clarify if this includes our private health workers in private clinics like dialysis centers who have also been exposed to many COVID-19 patients. In addition, may we recommend that the SRA and the AHDP should be given to all healthcare workers with the amount of 5,000 and 3,000 monthly, respectively, without having to divide it by 22 days. Because in actual situation, our infected health workers who needs to be on 2 weeks leave, or others who have been exposed and need to have 2 weeks quarantine, do not receive the benefits, which is unfair to all their contributions, no, in our COVID-19 response. Also, we would like that our most vulnerable health workers be really provided with all these benefits. They deserve and require sustained compensation. So having it retroactive to July 2021 is very much supported by our organization. Secondly, we would like to seek the understanding of the good committees of Blue Ribbon Committee, Finance and Ways and Means, and the Good Chamber of Senate to ensure that nurses and other health workers who got infected will be given the COVID-19 compensation regardless of the severity, asymptomatic to symptomatic, and most especially when they get infected repeatedly, with the minimum amounts of 50,000 for mild and moderate, and 100,000 for the severe and critical patients, and 1 million for those who will die due to COVID. With regards to the proposal of the Department of Health to have this classification of health workers according to risk, from low, medium to high risk, we will be studying this immediately with our members, and we will submit our position paper. But rest assured that we will consider two major points. One is the fact that whatever we agree should be fair for all health workers. And that second, we have to adopt the most simplified and practical ways by which our health workers will be able to access these benefits. May I end by saying that the Filipino Nurses United would like to thank and honor all our nurses, doctors, and all other health workers in their courage and dedication in serving our people, especially the poor majority at this time of pandemic. Likewise, may we express once again our support to the Senate Blue Ribbon Committee and chaired by Senator Gordon and this committee the Committee on Finance, chaired by Senator Angara, in its quest for truth and accountability, despite the odds, so that the funds deserved by our people and the health workers may be felt and received at this difficult and trying time of pandemic. The Filipino nurses would like to salute and thank you for this opportunity. Magandang araw po sa ating lahat.
Thank you very much, President Benohar.
Chairman.
You raised some a very valid issue, and we'll ask DOH if they're ready to respond to that on the number, the base number of 526,000 or so. Could you share how that figure was, what that includes, what it excludes, Secretary Duque, or anyone from the DOH or the government?
Mr. Chairman.
Yes, Chairman Gordon, please go ahead, sir.
I would like to thank the Philippine Nurses Association, headed by their president, who just made some very nice remarks about the blue ribbon. I take that as a. I take that not as a. I take that out of duty, ma'am. Maristela.
Yes, sir, Senator.
We do our duty, and it is not fun to fight with people who are crooks in government. It is not fun to fight with a president that seems to have forgotten their duty to protect the nurses, to protect the people. Of all people, you are most aware that I have been fighting for the nurses ever since I was senator. Even in board exams, when there was a lot of cheating in the board exams. And I was the one who put in, and I'm not trying to earn brownie points. It is out of duty that we fought for the medical profession. If they die or if they get sick, I was the one who put in all the amendments. And my point lang here, Ms. Benohar, is that thank you. It is not necessary, but nonetheless, I am proud that you have noticed what we try to do here because it is important. We have to speak our mind. We have to speak with our hearts. And we know that you take great risks. And those risks must be recognized, no less than by the Department of Health and most importantly, the President of the Republic of the Philippines. Kaya naman po, sa umpisa pa lamang ng Blue Ribbon, inuna ko na po yung sinabi ko na itong uumpisahan natin, ang nurses muna. At yun na po ang ginawa natin. Sa pangako po natin, ang inyong abang lingkod, nung hindi masyadong naasikaso kagad, and fairness to Secretary Duque, he said that he was gonna set aside some money for that. I immediately came out na mabigyan ng mga health workers ng pagkakataon. Masabi sa pamagitan nitong batas na ito, itong panukalang batas, na maraming mga senador ang sumusubaybay at sumusuporta para matulungan talaga ang mga healthcare workers natin. So, I just want to thank you for your kind words. I certainly will tell my wife about it because my wife has been totally distressed by this. My family has been totally distressed by this. It is not easy. Hindi madali. Mumurahin kayo ng Pangulo natin and that's fine with me. Kaya ko yan. Pero pag nananakot na siya, magsasalita na siya, napapatay siya, at bababuyin niya ako hanggang kamatayan, well, kaya ko pa rin yan. Ang sinasabi ko lang, ipaglalaban ko ang mga nurses, ang mga healthcare workers at lahat ng Pilipino na tapat sa kanilang tungkulin habang may breath pa ako sa aking katawan. At yan po ang gusto ko sabihin sa inyo. Thank you very much, Mr. President, Mr. Senator, for allowing me to say a few words. I'm sorry I'm a bit very, very emotional about it. And it's because it's not been easy. And if the President thinks I'm having fun with this, he is totally wrong. As he's missed the point so many times in the past, he is again missing the point. Thank you, Mr. President.
Mr. Chairman.
Thank you, Blue Ribbon Chair Gordon.
Mr. Chairman.
We have waiting with us Vice Chair Bato. You want to? See, Senator Bongo is waiting to say something. Say, go ahead.
Just a very short reaction lang, Mr. Chairman, from the comments of Senator Gordon. Did I hear right?
Vice Chair, go ahead, pero siguro it's the last reaction to a reaction that we will allow because hindi tayo matapos kung panay, Go ahead, sir. Go ahead, sir.
Just to set the record straight, Mr. Chairman, did I hear Senator Gordon, did I hear it right that the President said that papatayin ka niya? I just would like to, for the record, Mr. Chairman.
With the record of the President, and I have been very, very set back on that, and I've been accused of coddling the president, which I have not. Let me tell you in no uncertain terms, the president has no right to say, bababuyin kita hanggang mamatay ka. When you say words na mamatay ka, you take it seriously. There's already one death assassination in the family. And I take it to mean that I have to defend myself. And when a congressman says, mabuti pa ikaw, nakatindig ka pa, yung ibang lumabang kay presidente o lumabang sa kanya ay nakatumba na, I take it seriously. Now, if you want to defend the president on that score, I'm trying to be objective about the whole thing, but when you say things and when you lie about many things that are happening in this country, especially on what we do for suffering humanity in the Red Cross, I have to speak out.
I'm just trying to
The Red
set
Cross
the
has
record straight.
saved many lives in this pandemic.
I just want to set the record straight, Mr. Chairman. Kaya nga ako nagtatanong para maklaro kung sinabi ba ng Pangulo na nagsabi na papatayin niya si Senator Gordon. Yun lang sa akin. I'm not defending the President. Ako, klaro lang. Whatever you want to do, Senator Gordon, wala akong problema. Ang akin lang is, did I hear it right? Na sinabi ng Presidente na papatayin ka niya.
I said what he said, and that's enough for me.
Kakampi kita. Hindi ako papayag na gano'n, na papatayin ka lang.
Well, thank you. Thank you very much.
Gusto ko lang maklaro.
The president should never say those things.
Okay, thank you. Thank you.
To anybody in this country.
Thank you, Mr. Chairman. Salamat.
Thank you, Senator Bato.
Thank you, Your Honors. Thank you. We'd now like to acknowledge another Vice Chair of the committee, and he's the Chairman of our Health Committee, Senator Bongo. Your Honor, good afternoon.
Good day, Mr.
Good
Chairman.
morning pala.
Good day, Mr. Chairman, and to our colleagues and resource persons. At bago ko po umpisahan ang aking short statement, sa kasamahan ko rito sa Senado, hindi naman po sa dinidepensahan ko ang ating Pangulo, pero hindi niya po magagawa yon, Mr. Chairman, pumatay ng isang tao. At alam naman ni Senator Gordon na mahal ka ng Pangulo eh. Alam mo naman yun noon, sir. Pero anyway, ako na po nagsasabi sa inyo. Siguro maybe issues lang po ang pinaglalaban dito. Pero yung sabihin mong patayin, hindi niya po gagawin yun sa inyo, Senator Gordon. Mr. Chairman, I want to underscore the importance of 2022 budget in overcoming the health crisis we are facing today. Foremost in this fight, we must ensure the well-being of our health workers. As such, I want to highlight the need to include in the 2022 budget the allowances for our healthcare workers. Nakataya po ang buhay nila dito. Bawat araw po ay nasa panganib ang kanilang buhay. Ito ngang nakaraan, umabot na po sa full at critical capacity ang ilan sa mga ospital dito sa Metro Manila, kagaya ng St. Luke's Medical Center, Medical City, Cardinal Santos Medical Center, UERM Medical Center at ang Philippine Heart Center. Dahil sa dami na po na nagpapagamot at dahil nahahawa at nagkakasakit na ang karamihan sa kanilang mga healthcare workers. This is why President Duterte asked the Armed Forces of the Philippines and the Philippine National Police to deploy members of their medical corps to reinforce hospitals. Sa totoo lang, po, hindi nababayaran ng kahit anuman po ang buhay. Ngunit mahalaga na bilang pagkilala na rin po sa sakripisyo nila para sa ating bayan, bigyan natin sila ng dapat nilang matanggap. For the provision of special risk allowance for the first part of the year, President Duterte has directed the Department of Health and the Department of Budget and Management to expedite the provision of the mandated allowances. Recently, the President approved the release of 407 million to cover the SRA of additional eligible health care workers. With this, the government will be able to cover the SRA of a total of 117,926 more healthcare workers since the President's pronouncement. Hindi pa po natatapos ang pandemya, kaya dapat tuloy-tuloy lang ang pagbibigay natin sa kanila ng mga benepisyo. In this regard, I filed Senate Bill 2398, which provides allowances and benefits to healthcare workers during the existence of the state of public health emergency due to the COVID-19 pandemic. The bill provides benefits and allowances to all healthcare workers who are engaged in health and health-related work in health facilities during the state of public health emergency. Mas inclusive po ang coverage ng mga eligible sa allowance. Hindi na po natin nalilimitahan sa mga directly catering to or in contact with COVID-19 patients. This is in line with the with my earlier call to expand the provision of the SRA to all healthcare workers serving in the hospitals. Lahat naman po ng healthcare workers na naka-duty ay maituturing na expose sa banta ng COVID-19. Hindi po nakikita ang kalaban na ito kung kaya't mahirap po paghiwalayin kung sino po yung exposed at sino po ang hindi. Sabi ko nga, pagdating mo sa loob ng hospital, hindi mo man po masasabi kung hindi ka exposed. Dahil sa loob ka ng hospital, prone, excuse me, pag nasa loob ka na po ng hospital, prone at maituturing na exposed ka na rin. Hindi mo masasabi kung walang virus yung dinaanan mo kasi nga, hindi natin nakikita itong COVID-19. Until the bill ay dapat affix monthly COVID-19 special risk allowance for every month that they are serving during the state of national emergency will be provided to them. The allowance will be in addition to the hazard pay granted under the Magna Carta of Public Health Workers. Nananawagan na ako noong nakaraan sa DOH na maging flexible tayo kung kakayanin po ng pondo. Bigyan na ang lahat ng qualified ng fixed na amount ng SRA kaysa bilangin pa natin ang kanilang pag-duty bawat araw. Nagkaroon kasi ng mga reklamo sa computation at minsan hindi naging transparent ang computation. Ako mismo, maraming lumalapit. Para maiwasan po ito, mas mabuti kung fixed amount na kada buwan ang allowance. The measure also provides active hazard duty pay for public health workers. In the event of COVID-19 exposure or any work-related illness or disease, the PhilHealth will continue to cover all of their medical expenses. Public and private healthcare personnel who contract COVID-19 in the course of their work will also be compensated. To provide enough legal basis for the continued provision of allowances this year, we are including in the bill retroactive application of allowances beginning July 1, 2021 at all allowances will also be tax-free. As healthcare workers continue their life-saving work, it is incumbent upon the government to show our gratitude by providing them benefits that may improve their financial situation. They should not be made to be indefinitely bear the pressure of fighting a deadly virus without adequate compensation. Kailangan ay hindi sila pabayaan ng gobyerno at ang ating medical frontliners ay ang mga sundalo sa gerang ito. Sila ang itinuturing nating bayani sa laban na ito. Pakiusap ko lang po sa mga frontliners, huwag ko kayo mawalan ng pag-asa. Tulungan niyo po ang ating mga kababayan kasi kayo po ang nakakaalam sa gerang ito. Lastly, Mr. Chairman, I want to take this opportunity to thank our healthcare workers. Lubos po ang aking pasasalamat sa mga frontliners na patuloy na nagsasakripisyo at nakipaglaban sa pandemya upang masiguro ang kaligtasan ng mga kababayan natin. Rest assured na handa kami ni Pangulong Duterte na makinig at magserbisyo sa inyong lahat. Salamat po muli sa inyong sakripisyo sa panahon ito. Thank you, Mr. Chairman, for giving priority to this important measure. Tamang-tama po na nasa gitna tayo ng deliberasyon ng 2022 budget at kayo po ay isa sa mga champion ng panukalang batas na ito. Tulungan po natin sila, Mr. Chairman. Maraming salamat po. Magandang umaga.
Salamat po to our health chairperson, Senator Bongo. Thank you, sir, for your support, your filing the measure, and your support for our health workers. I think we had a pending question kay Secretary Duque. Sir, would you like to comment on that question of the FNU before we recognize ULAP and St. Luke's and all the Red Cross and all the other resource persons?
Yes, thank you. Thank you, Mr. Chairman, for giving me the floor. The 526,727 healthcare workers we have called this from the different facilities where generally there is a risk exposure to COVID-19 patients, or in fact even those suspects and probable in the various temporary treatment and monitoring facilities, the isolation and quarantine facilities. So we have listed down those healthcare workers comprising the emergency hires that the DOH does every year, the GOCC hospitals, heart, lung, kidney, and the Children's Hospital, the military hospitals, the private hospitals, the LGU hired emergency responders, the barangay health workers, the LGU primary care facilities, the LGU hospitals, the Human Resource for Health Deployment Program of the DOH, precisely to augment any gap in human resource requirement in other facilities. And then, of course, all of our DOH hospitals and DOH staff. I have the numbers equivalent to each of these facilities that I have mentioned, and it's totaling 526,727. However, the resource person from the Filipino Nurses Association is correct, no? We have vaccinated close to about 1.6 million healthcare workers, but a lot of this are actually don't have the same level of exposure. So we need to stratify. But by and large, if the resources are available, why not? I mean, we fully support that everyone ought to be given benefits. Thank you, Mr. Chairman.
Thank you,
Mr. Chair.
Secretary Duque.
Mr.
Who is
Chairman.
that? Sorry.
Joelle.
Yeah, Vice Chair Joelle. Yes, Vice Chair Joelle.
Very short lang, just to be clarified with the data given to us by the good secretary, and with the indulgence of our good friend Governor Dax, we wanted to listen to him. Just very short po. Perhaps it's about time we mentioned the 87% figures. What's the 87% figure, the 7%, the medium, the 6% low? Just to be clarified, kasi lumalayo tayo, ang dami yung mga figures. And with the 87%, 7%, and 6%, 500,000 lang po yung total yan, hindi ko ba? So perhaps this is the right time to get the figures, Mr. Chair, if you would allow me, Mr. Chair.
Please furnish our members as well as the body secretary with all of those calculations. If you have them now, please flash them on the screen. If you have them already, maybe we need. Could you tell us also which establishments will be covered para we can manage the expectations somehow? No.
We will do that, Mr. Chairman. We will give you a definitive list of establishments, healthcare facilities, where the proposed benefits will be granted. The query from the Honorable Senator Villanueva, we will would like to ask the chair to very quickly recognize Assistant Secretary Beltran, who will
Yes, Asik Beltran,
clarify.
please, to answer Senator Gatchalian's question. I'm
Yes,
just kidding.
sir. Yes, Mr. Chairman. Thank you po, Senator. Let me just correct myself po earlier. Hindi naman humali, sir, pero yung sinabi ko palang mga percentages kanina, yung 6%, 7%, and 87% is based on the 50.4 in terms of funding po, funding requirements. So
Not
6%
the number.
of 50, not the number of HCWs. Sir, Mr. Chairman, just to correctly put it, in terms of percentages of healthcare workers, the low risk would be 15%, the medium risk will be 9%, and then the high risk will be 76%. Yun po, Mr. Chairman, and thank you for this opportunity po na na-correct po namin yung figure. So again, 15% for low, 9% for medium, and 76% po of the total number of healthcare workers po. Salamat po.
Thank
Thank
you.
you.
Thank you.
Thank
Please
you
don't
for
remove the slide
asking that
first.
question.
Please don't remove the slide first, please.
Pakibalik ho, ASEC, para I think some of our members are still looking at it.
Thank you, thank you.
Yeah, I can just leave it on the screen for now, so it can be digested kasi maraming zero. Medyo malalaki yung mga numero.
Mr. Chair.
Yes,
Mr. Chair. This is Nurse Bench from St. Luke's Medical Center Employees Union, and I guess in response to the data, we see that the lots of benefits is for all health workers. Supporting the data of the Filipino Nurses United, that we have to get the exact data of all the health workers in all the Philippines. Kasi alam nyo, Mr. Chair, marami po mga even nurses, some of our health workers doesn't receive the benefits stipulated on the law kasi po baka hindi po sila kasama on these figures po from the DOH. Yeah, we understand the category that the DOH determined, but yun po yung questions, bakit ganun lang po kakonte yung health workers na binibigyan nila? Kasi in fact, in most of our provisions in the law, like the meal, accommodation, and transportation allowance, that provision is for all health workers. And nakakalungkot nga hanggang ngayon sa amin sa St. Luke's, wala pa kaming na-receive dyan eh. But the DOH shows a data na nagbigay na daw po sila. Yung question namin doon, sino po yung nabigyan nila? Kasi sa amin hanggang ngayon wala pa. And I guess, Mr. Chair, if you give me the opportunity, I can show the positions or our positions in response to that and some clarifications. Maraming salamat po.
Yeah, I was about to recognize you after ULAP actually. If you can just wait a little bit more, you'll be recognized, sir. Thank you. We'll get back to you for a longer position. Can we hear from ULAP, our friend, former colleague in the House, now Governor and the President of ULAP? Sabi ni Senator Joelle from BTS daw. Governor Dax Kua. Governor Dax, are you there, sir? Governor Dax? He might. I see Senator Gordon raising his hand. Yeah, go ahead, Vice Chair Senator Gordon.
Mr. Chairman, thank you very much. I just want to express my thoughts.
Yes, sir. Yes, sir. Go ahead, sir.
That the healthcare workers have to come out and talk about what is due them. I think it behooves the Department of Health and this Senate to immediately act on this proposal. We also heard the PGH director, and we know what these nurses are going through, what these healthcare workers are going through. I hope that the Department of Finance will see its way clear to really find a way to provide, mabigyan ng tulong itong mga kababayan natin, ng mga healthcare workers. Tama yung sinabi ng taga St. Luke's, si Nurse Bench. Maraming hindi nasasama. Ito nagsimula itong problemang ito dahil hindi maayos yung listahan natin. So madami tuloy na feeling nila deprived sila. And dami natin sinasabi dito, dapat malaman natin sa Department of Health. Meron ba na kayong listahan na talagang kompleto na? Yung mga barangay healthcare workers, lumalabas yan. Pag lumabas yan, o yung mga komodrona, pag lumabas yan, talagang dapat tulungan natin yan. Otherwise, matatalo tayo dito sa war na ito because this is a very cruel disease. It kills doctors. I just had a text from a friend of mine whose nephew is a doctor who just died in America at that. So, sa akin, kailangan talaga tugunan natin itong sinasabi dito ng mga healthcare workers, talagang tiisin natin dahil unahin natin kung ang mga sundalo, sabi nga ng General Bato, binibigyan natin ng tama na panlaban, meron silang combat pay, meron silang lahat ng meron pa silang retirement pay. Bakit hindi natin bigyan itong this is a battle to the death and our people will die without the healthcare workers. Kaya nakakahina ng loob na kailangan makiusap pa ang mga nurse at saka mga healthcare workers sa atin. Gawin na lang natin yan. Kung ano ng paraan yan, Department of Finance at saka Department of Health. Pag-usapan nyo na kagad, umaksyon na tayo. Thank you.
Thank you to our Vice Chair, Blue Ribbon Chair, Senator Dick. That's well said. And we will rush this measure that he filed along with this representation and supported by many of our colleagues. And of course, we'll need the support of our colleagues to, if we need to make any budget cuts, might be some might be controversial. Majority Leader, yes, go ahead, sir.
Thank you, Mr. Chairman. I just have to go to another meeting. I just want to put on record that I fully support this measure and would move to endorse it to plenary for immediate action. Whatever we need for budgeting for this, we can search. It's budget season. I'm sure there are unnecessary funding out there that would best be coursed to this measure that will be able to help our health workers. I think the Senate has been squarely on the side of the healthcare practitioners, and we've seen that. We've seen our chairman of the Blue Ribbon go out of his way, risking his own life and limb, just to push for the benefits of our healthcare workers. And I am proud of my chairman of the Blue Ribbon Committee. I'm very proud of you, sir. Not because you're all my ninong, but I really feel that you are defending our institution and all other institutions that need to be defended with situations and issues that are being raised. And I commend you for that, my chairman. And again, the soonest possible time we can take this out of plenary, you have my full support. Wala nang interpellation, kausapin na natin lahat, pasalan natin. And let's send it up to the executive, hopefully for their also concurrence, Mr. Chairman. Thank you. And again, God bless our chairman of the Blue Ribbon Committee, and God bless all the men and women who are sacrificing their lives for our people, particularly the healthcare workers. Mabuhay po kayo lahat. Saludo po ako sa inyo.
Thank you. Thank you very much, Majority Leader. Kahit di mo ako binanggit, salamat din po.
ikaw ay napakahalaga dito, Mr.
Joke lang,
Chairman.
joke lang. I'm just
Hindi
kidding,
kita.
Majority Leader. We second what you said, and we appreciate your support for the measure. We really need to rush this for our
Chairman,
health.
You are the most important here because we need budget. Without you, we cannot have the budget for this measure. So maraming salamat, Chairman.
We need to do it together, Your Honor. And I think there was a very good point by our Blue Ribbon Chair, Senator Gordon. Yung data po natin, I think for government to have a really good response, we must be data-driven. And that data, if it's garbage in, garbage out ho tayo. So I think that's something we have to address across the board, and pagtulungan ho natin yan, Your Honors. So now finally, we go to ULAP. He's been waiting for some time now. Our friend Governor Dax Kuwa. Go ahead, sir.
Thank you, Mr. Chair. To the esteemed members of this committee or joint committees and honorable senators and fellow resource persons, magandang umaga po. I will make this very short. Mr. Chair, the Union of Local Authorities of the Philippines, or the umbrella organization of our LGUs, fully support both House Bills 2371 by Senators Angara and Gordon, and of course 2398 by Senator Go. Tama po yung mga nabanggit kanina. Talagang our heart pours for the men and women of our healthcare sector. Mr. Chair, kung minsan napapansin natin, especially these past few weeks, dahil may mga surges in many parts of the nation, talagang exhausted and extended na po talaga ang serbisyo nila. And I've seen a lot of hospitals and local governments being creative and involving men and women from outside the professional healthcare realm to support and help the effort against COVID or in terms of COVID intervention. Case in point po, Mr. Chair, kapag punong-puno po yung hospital natin, minsan we employ the services of tourism facilities or schools to become step-down facilities. Tapos nilalagyan na lang po natin yan ng health workers to support and to manage the isolation or the step-down in these facilities outside of the hospital systems. So I'm glad that your bills are innovating from the challenges of the previous support that we received from national government, Mr. Chair. Particularly, nyo na po explicitly nakasama na po yung non-medical workers, kasama na po yung mga job orders, kasama na po yung mga IT and security staff. Kasi kung minsan, Mr. Chair, pag puno talaga at may surge, kahit security guard, pinapatulong na sa pag-handle ng mga pag na-navigate ng patient, ina-assist na lang at gina-guide na lang ng mga health workers. Pati mga IT staff tumutulong na, pati mga nasa accounting department tumutulong na dahil sa dami ng mga pasyente ngayon, Mr. Chair. So it seems like you are on the right track, Mr. Chair. We fully support, and most especially we support, Mr. Chair, the fact that this proposed measure also covers employees and healthcare workers and non-healthcare workers under the local government units. Alam niyo naman po, sa dami ng mga COVID response that we have to manage, from contact tracing to isolation to quarantine to border checkpoints, talagang exhausted na rin po ang resources namin, and this would help really in giving support to our healthcare workers. So Mr. Chair, basically all praises and support. Siguro for clarification lang po, nangyari lang po kasi nung huling SRA na binigay ng national government, the intention of the national government did not fit. Kumbaga hindi pareho doon sa nakasulat sa implementation guidelines. So nagkaroon ng problema, that's why nagkaroon ng delay doon sa mga releases. Hopefully this time around, of course, that is outside the realm of the Senate. With the help of the DOH, baka maging mas malinaw and precise na yung language ng implementation guidelines, so that hindi na po magkaroon ng gusot yung pagbibigay ng tulong. So yun lang po, Mr. Chair, and salamat po and congratulations.
Thank you. Thank you very much to our friend from ULAP, who's a very hands-on chief executive. So he gives us the view from the ground. Salamat po, Governor Dax.
Mr. Chair, before I,
Yes,
Mr. Chair, before
Majority
I
Leader
lock
and
out
then Senator Gordon. Go ahead,
just
Majority
really
Leader.
half a second. Can I be made a co-author and co-sponsor
Of course,
this measure?
certainly,
Mr. Chair?
certainly, Your Honor.
Thank you very
Senator
much.
Gordon, Vice Chair.
Short remark to
Senator
thank
Gordon.
Senator Subiri, the majority floor leader, and my colleague and my friend for his kind remarks. All of us are imbued with that kind of devotion, especially to the healthcare workers. They have earned it, Mr. Chairman. All of them have earned it. And that is why we have to push for this. Thank you very much, sir.
Thank you very much, Majority Leader, and thank you very much, Senator Gordon, for your passion, your commitment, your dedication.
Mr. Chair.
Now we'd like to hear from our representative from St. Luke's. You have the floor, sir. Who is seeking? Sorry. Pakitanggal na ho sa admin. Pakitanggal na ho yung slide with the permission of the body para we can see all the resource persons. Who is was someone calling my attention before I recognize the St. Luke's nurse bench? Was someone calling me? No? Okay, go ahead, nurse bench. Go ahead.
Right. So, ayan, Mr. Chairman, allow me to share my slides po. And St. Luke's Medical Center Global City Employees Union Independent is an organization committed to serve interests of employees and general member, including St. Luke's nurses, medtechs, radtechs, pharmacists, PTs, dietitian, nursing attendants, and other professionals with more than 1,500 members. That's only for our hospitals. But, you know, in this, before attending this hearing, we are coordinated with the different hospitals or the different private hospitals union. And it's fortunate for us that you invited us in joining in this meeting. As our organization and other union groups from different hospitals continue to advocate decent job, fair compensation, and good benefits to our health workers, the proposed Senate Bill number 2371. Wait lang po, I'll share my slides po. The Senate Bill number 2371, Senate Bill number 2398, and Senate Bill 2406 brought us great hopes and courage as we continue to serve for the health of every Filipino without or with or without pandemic. We are in full support on this formulation, and we appreciate your initiative on hearing our voices and our rights. And I guess, Mr. Chair, my slides are loading there. Can you see my slides po?
Yes, we can see it. Please go ahead.
There. So again, to our honorable chairman and the rest of the senator or from this hearing, we really appreciate, and it is our pleasure to share with you our positions. So we submitted a position paper earlier before this hearing, and we stand firm and asking for the support of the legislations processes with the following salient points to all hospital staff and health workers, to both public and private health workers regardless of employment and quarantine status. First is the benefits such as special risk allowance of 5,000 per month to those assigned in COVID unit should be extended while we are in the pandemic, and provide risk allowance or active hazard duty pay in amount of 3,000 per month to those who are not assigned in COVID unit with monthly and timely release once approved. But on the proposal of DOH, they categorize it as a low, medium, and high. And I don't get, I don't see the justification about it. But sana po, yung gusto po namin is para sa lahat. Kasi po, the active hazard duty pay provision po on the Bayanihan Act 1, wala po kami sa private sector doon. And unfortunately, wala pong natanggap yung private sector doon. Just on the Bayanihan Act 2 lang po, which is only the SRA. The number 2 po is to provide all hospital staff free hospitalization benefits and their immediate family members, paid quarantine leaves, provision of vitamins and medical insurance and mental health consultations. Also mandate all hospitals employers in the private sector on the share of PhilHealth contributions on their employees, which is practiced in the public sector. Hindi po kasi yun napapractice in the private. Also, income tax exemption, as mentioned by Senator De La Rosa, for all the health workers and all receive benefits to augment the take-home pay. And also strict implementation of mandatory tests for every 15 days to ensure everyone's safety, and prompt contact tracing and implementation of safety guidelines in the public. We know that in the Bayanihan Act, there's a periodic testing among health workers, but unfortunately, it is not implemented in the real scenario. So sana po, if we're going to extend these benefits, sana po maganda po yung implementation. The next is active consultation and discussion with the hospital's administrations, all organizations involved, and employees group for the guidelines at the implementation of every provisions. Para po hindi po tayo magugulat na naglalaps na po yung law at hindi po nakukuha yung mga benefits na dapat ay para sa amin or para sa ating mga health workers. Just what happened with our Bayanihan Act previously. And also to ensure every health workers get decent work schedule and in accordance to the labor standards of 8 hours in a day and mandatory 30 minutes meal break in between shift and no forced overtime. Every hospital staff should perform reasonable workload and patient ratio with a proper training on handling patients before deployment on assigned unit, especially to COVID units, with hiring enough staffing and plantilla or regular position. The reason why our health workers are resigning because they are exhausted, they are overworked, and they are tired. Sana po mapansin po natin ito. And last, to continue the prescribed supplementary guidelines on the provision of life insurance, meals, accommodation, transportation allowances monthly, timely release once approved. Kasi po, matagal na pong naglaps yung Bayanihan Act, pero hanggang ngayon as in the private sector, hindi pa namin natatanggap yung mga ganitong benefits. Sana po that would be the lesson for us para naman po mabigyang pansin po at mabigyan ng importansya yung mga undervalued natin ng mga health workers, lalong-lalo na po sa amin sa private sectors. Next po, just recently, kahapon na po ito, trending po ito kahapon. In our institution, it is not about the COVID-19 outbreak why the hospital is full. The real scenario po, it's because we are lack of nurses. We are lack of health workers. Maybe some of you or a lot of our countrymen or a lot of our Filipino countrymen, a lot of our fellow Filipinos are not getting enough medical attention because all of our hospitals are full. The reality po, some of our units are closing because we are out of nurses. Wala pong magjo-duty in a certain unit or in a certain ward kasi po wala na pong nurses. And sayang po, kasi baka kakilala nyo po or kapamilya nyo po yung mapupunta sa hospital at tatanggihan po ng hospital kasi hindi na po nila kayang alagaan. Kasi sarado na po yung ibang units. Kasi wala na pong nurses. Sana po mapansin po natin yon. Also, we commend some of the hospitals giving a decent compensation to our nurses. Nakikita niyo po siguro si Senator Gordon, familiar po siya on the first picture on the left, na ganun na po kataas yung compensations for some. But we are not really sure. Kasi tinatawanan po ito ng mga nurses. Kasi PR lang daw po ito. Kasi in real scenario, hindi po nila natatanggap nito. Yun po yung sabi nila. Sana po mapansin natin at sana po implement po natin ng maayos sa mga ganito. Also, some of our governments, the DOH, or hiring nurses. Nakakalungkot lang po kasi contractual job orders. Paano pa naman tayo makaka-attract? Paano naman yung mga nurses mag-a-apply if they don't have security in their work or security of tenure? On the right picture po, nakikita niyo po 13,000 po yung monthly salary for a nurse. Malaking insulto po yon sa mga nurses na halos binibigay po nila yung buhay nila tapos ganun po yung pagpapahalaga natin. And in some hospitals, nasa Rappler po ito na nagda-diaper na po yung mga nurses para lang po mag-attend sa mga patients natin. And how many nurses will leave us before giving our due benefits? And also, if mass resignation is the only option for us, who can give us a new hope? Kasi dito sa Pinas, admit lang tayo ng admit, hindi po natin natitingnan kung kaya ba ng manpower natin. And ini-extend natin yung mga nurses just to take care of our patients. But at the end of the day, mapapagod po yung nurses natin at magre-resign. Gusto ko pong ipakita sa inyo. I am from Capiz. The Rojas Memorial Provincial Hospital, may plan po na mag-resign yung mga nurses kasi 2 months na po silang walang sweldo. Kasi bakit? Pinopolitika po sila. Nakakalungkot po na inuuna po ng mga tao natin in the positions na inuuna pa nila yung interest nila compare sa priority problem ng country natin. Hindi po sinasaynan ng mga board members yung supplemental budget para po sa mga benefits ng mga health workers natin. Sana po wag nating hayaang mag-resign at alis yung mga nurses natin kasi hindi po natin sila pinapahalagahan. Because these nurses are tired and exhausted. And kailangan natin silang in-nourish at this pandemic. And also, dahil po naglapse na po yung law from the previous bayanihan, nagkaroon po kami ng mass action sa DOH. And unfortunately, yung mass action namin parang wala pa din kasi hindi pa din namin nakukuha yung benefits namin specifically on the mat. Anong petsa na po? And also, nagbigay po ng announcement yung DOH that they gave the benefits for our health workers, specifically on the mat. Pero po bakit nagbibigay sila ng numbers pero bakit hindi po namin napapansin sino po yung nabigyan nila? And yun po, if you read the comment section ni President Robert po, sana po matingnan po natin kung sino po itong mga naka-benefits specifically kasi po hindi po namin ramdam yung implementation on the ground. Baka po numbers lang po ito. So mas maganda po mabigyan po ng sagot ng DOH ito for transparency po. And also, ito po yung sinasabi po ng Malacanang and the spokesperson of Harry Roque po na ganito po yung response sila sa mga nurses natin. Of course, we need support, encouragement, and understanding, not humiliation. Sana po, suportahan niyo po kami, hindi po yung mga masasamang reactions para sa amin. Kasi po, pagod po kami sa frontline and kailangan po namin yung suporta po. Pero yung marinig po namin na ganito po, malungkot po sa part namin. And also, yun po, sinasabi ko po, the accommodation, the mat specifically, nandun po yun sa provisions, pero bakit hindi po namin nare-receive hanggang ngayon? And I guess this is the right time na masagot po ito kasi po, we're drafting a new law and we really appreciate the efforts among our distinguished Senate to have this. Pero baka sayang lang po ito, meron po tayong magandang law, baka pangit po yung implementation at hindi po natin mapakinabangan. Sana po before drafting that, maano po natin kasi there's a clear implementation. Nandyan po sa department order yung mga ganun po, bakit pero hindi po namin na-receive. So Ayun po, and also sana po yun po, sana po sa lahat kasi we have a clear guidelines and implementation, sana po ma-implement po ito sa amin kasi po hanggang ngayon po na umaasa po kami here in the front line na sana po ibigay po yung mga benefits na para sa amin para po tuloy-tuloy po yung aming serbisyo. Huwag po nating hayaan na wala ng mga nurses or mga health workers in the front line. Talagang hindi natin ma-revive yung crisis or the health crisis na na-experience natin. So nakikita niyo po yung mga templates, mga guidelines po ng DOH pero po unfortunately hindi po namin po na-experience yon in the front line. Ito po, clear po yung mga guidelines po ng DOH or yung mga press release po nila. Pero I don't know bakit po hindi po namin naramdaman po ito. So I guess in this hearing po, maybe end of our position and siguro it's a clarification na din and we really support, sobrang salamat po na sinusuportahan niyo po kami from the front line. And sana po magkaroon po kami ng clarification on this. Maraming salamat po, Mr. Chair. And yung question na po pala, may question ako po sa DOH before I end my time po. Ayun po, sana po clear po yung total number of health workers natin. Kasi alam po namin, we believe in the grounds po na hindi po totoo yung numbers na 500,000 plus lang po. Hindi po kakayanan ng Pilipinas na ganun lang po yung number ng health workers. Also, gusto po namin i-clarify po yung ano din po yung categories po na binigay ng DOH, yung low, medium, and high. And also the MAT, the Meal Accommodation and Transportation Guidelines. Maraming salamat po.
Thank you, Nurse Benz. I see our Vice Chair, Aimee, is raising her hand. Go ahead, ma'am. Opo. And then after Vice Chair Villanueva, after you. Go ahead.
Yes.
You haven't had a chance to speak,
Thank you very
we'd
much,
like
Chairman.
to hear your beautiful voice.
Yes, thank you very much, Mr. Chairman. It's simply to reiterate my wholehearted support for this bill, to which I am co-author now, and also lend my sympathy to Nurse Benji from St. Luke's as well as the other health workers. We live and die by data at alam natin yung listahan ng magiging madugo dyan. Kung anong kakayanin ng budget, kahit papano, ilista na rin natin. Malay mo, parang lista yan sa sari-sari store. Pagka nagkapera, di mabigyan, di ba? Lista lang muna, kasi private o public, high risk, low risk, wag na siguro guluhin yan, exposed, hindi exposed, telemedicine o hindi, at pati yung ambulance at janitors ng mga infected spaces. Siguro, isasuggest ko rin na yung ating mga medical associations, please naman yung DOH, ilang beses na natin sinabi, i-recommend sana na kasama sila sa pagka-craft ng IRR at makonsulta sila ng todo-todo. Kasi yung ibang problema nila, napakasimple naman talaga. Question naman of asking. At yung sinasabi na guidelines ni Nurse Benji at pati na rin ni Dr. Legaspi kanina, dapat maliwanag yon. Wag natin hayaan sa IRR. Right now, to my mind, the releases for the SRA and other benefits have largely been ad hoc. Perhaps we should establish a schedule once we've figured out what the budget immediately available is, so that may maaasahan yung ating healthcare workers. I-detalye na lang natin kasi hindi natin kinaya nung bayanihan ng 1 and 2 at nagmamadali. Siguro pilitin natin na kahit papano. Huli, maybe we should consider having some kind of institutional grievance mechanism, yung mga hindi nakatanggap, yung pangit yung mode of distribution, kung GCash na lang ang gagamitin para wala nang kaltas-kaltas, at kung ano pa yung mga daing, maybe it's important that we set up, even in the law, a grievance mechanism or even a penalty or sanction for those who do not immediately release the benefits to the people entitled. Kahit administrative sanction lang, even if it's a mere slap on the wrist, kasi this has been so delayed. Yun lang po.
Thank you. A lot of good points as well taken. When we finalize the committee report, we will hope to address a lot of those. Vice Chair Joelle, yeah.
Thank you, Mr. Chairman. I was cut out of the connection after the manifestation and statement by Governor Dax. I wanted to say something, but also it was a blessing in disguise because I got a chance to listen also to Nurse Benji, and just like Senator Marcos, I also feel you and your colleagues. You know, Nurse Benji, I lost my mom and my sister in St. Luke's in this pandemic. Two members of my immediate family. I've seen the work of our healthcare workers and why we wanted to really do something for them. You made mention about the shortage of healthcare workers. And again, in my opening statement a while ago, I made mention about 25,067 job orders in the Department of Health. We have 25,067 job orders, but there are 13,428 unfilled positions in the department. And the department also gave us 12,278 vacant positions. So I wonder why this number continue to be that way. And I think records will bail me out every single year. I would point this out, not only with the Department of Health, but in all agencies of the government. But let me just show something, Mr. Chairman, just to strengthen our position with regard to SRAs and the benefits for our non-medical healthcare workers. No, share the sentiment of the chair, the chair of Senator Angara, Senator Gordon of the Blue Ribbon, kanina kay Senator Baturet, Senator Go also. If you look at this DOH situation or dated, this is dated 19th of September 2020, Mr. Chairman. Titingnan po natin at the medical healthcare workers, nasa 0.1%, 3%, o 0.4% yung fatality, Mr. Chair. Of course,
mataas.
Ang dami po, mas malaki ho. And then if you go to the non-medical, Mr. Chairman, just to put this on record, yung non-medical deaths po, if we could highlight yung 1.3% na death rate ng mga doctors, 1% po yun, and yung nurses yung 0.3%. Pero siguro tignan din po natin yung death rate ng non-medical healthcare workers. For example po yung mga hospital employee, ang death rate po nila ay 4.3%. We just want to emphasize in this particular data na hindi lang po healthcare workers yung directly na-address ng problema ng COVID, yung naapektuhan. So we are suggesting po that we broaden the scope of the bill that includes non-medical healthcare workers, Mr. Chairman. Kung titignan din natin yung case count, ayan na, numbers don't lie, nandyan po lahat yun. And last but not the least, Mr. Chairman, that I'd like to raise, yung binabanggit ng halos ng lahat, no? What have we learned so far? Matagal na po itong COVID, dadalawang taon na. Ano na yung mga natutunan natin? Ano ba yung mga bottlenecks? If we remove, for example, the pro-rating of benefits and just provide for a fixed monthly amount of SRAs and active hazard duty pay, what documentary proof required from HCWs will be eliminated? Pangalawa, how will this affect the provision of benefits from request of appropriation from the DBM to downloading to centers of health development to the hands of our healthcare workers? So ito lang po yung gusto nating i-share, and I think very important as we move forward. Again, Mr. Chairman, thank you, and I'm fully supporting this mission.
Thank you very much, and thank you for sharing that very illuminating data with us, Vice Chair Joelle. Again, we apologize to some of our resource persons who have not had the chance to be heard, and now we'll give them a chance. The Philippine Red Cross with former Health Secretary Paulino Bial. Ma'am, you have the floor. I thank you for waiting patiently.
Yes, thank you, Mr. Chair, and to the members of the committee. The Philippine Red Cross has been a partner of government in this pandemic as auxiliary to the government efforts. And we have many of our workers as frontliners in this pandemic. However, in the implementation of the benefits for Bayanihan 1, we were not included because we're categorized as private sector. And for Bayanihan 2, actually, we submitted a long list of our frontliners. However, only those working in the molecular laboratory were given the benefits. And we've continually requested for our other frontliners, like those working in the ambulances, ambulance services, the welfare services. Now we're also putting up isolation facilities and the vaccination centers, that they also be included as part of the frontline health services. And unfortunately, even in the implementation of the Bayanihan 2, where private sector health workers were supposedly included, we submitted a list, and some of the health workers there, I don't know what the criteria was delisted. And even one of our lab managers and some of our encoders who are actually in our listing of those who get COVID are among the highly susceptible, the encoders, because they talk to the symptomatic patients. However, having said that, we hope that the implementation of this new law, Senate Bill 2371, authored by Senator Gordon and Senator Angara, and Senate Bill 2398, authored by Senator Go, we fully support the provisions, and we hope the implementation will be properly addressed and smoothly uh, um, uh, implemented. And we would like to just also include a recommendation that the guidelines must be clear for the provision of this benefit. We support the mild, medium, low, medium, and high categorization, because getting a low benefit is better than no benefit at all for those considered not directly attending to COVID patients. And we also want to support the provision that we provide a monthly allowance and not count the number of hours or days of work, because here in the molecular lab, we've actually changed the work schedule because of the intensity of the work and the shall we say, use of PPE is really people cannot take it for long hours, and the standard number of days of reporting. So what we usually do is 3 days on, 3 days off. So with that arrangement, only 15 days a month and not the 22 days are actually reported by our health frontliners. So I hope that that will be addressed. And the other issue that we would like also to point out is that we provide the benefit uniformly and consistently, regardless of community quarantine status. Because I think there was a time when only when we were in ECQ will we provide the SRA or the active duty hazard pay. Okay, so with that, the Red Cross emphasizes the importance of providing benefits to public as well as private healthcare workers, especially during the period of COVID-19 pandemic and when the country is under a state of national public health emergency. The continued provision of relevant allowances and benefits to our health workers working tirelessly for the Filipino people is only right and just. As we look forward to improving the healthcare system, we enjoin both houses, House of Representatives and the Senate of the Philippines to continue enacting laws that uplift the working conditions and compensation of all healthcare workers. Thank you.
Thank you very much, Secretary Bial, for the Red Cross. Some very good points there about the difficulties faced by our health workers. We'd now like to hear from PhilHealth. Again, thank you for waiting patiently, Your Honors. We have VP Shirley Domingo and Dr. Herrera with us. Thank you for waiting patiently. Specifically, what is the financial situation of PhilHealth like, and would they be in a position to contribute to any measure passed for 2021 or 2022? Perhaps that could be answered among others. No? You have the floor, ma'am, please.
Thank you, Mr. Chair. Well, I noted two. Sorry, I noted two issues that were brought up in relation to the discussion and the opening statements of the different resource persons. One was the contribution of the healthcare workers. As mentioned also by Dr. Atienza himself, this is in the law, and therefore we can change only the amount to be paid by the doctors if there's amendments to the law. Right now, the UHC contribution in 2021 is 3.5% with a floor of 10,000 and a ceiling of 70,000. So 3.5% of that is contributed as a premium. So that's one issue. And
Could you repeat that, VP Shirley? Could you repeat what you just said, yung regarding the ceiling and the minimum, please?
Yes, this is in the law, in the Universal
Yes.
Healthcare Law. 2021, the amount is 3.5% of your monthly salaries or earnings, and therefore we have a floor of 10,000 and a ceiling of 70,000. So for a 10,000 salary and below, it's 350 pesos a month, and for 70,000 and above, it's 2,450 pesos a month. That's the premium contribution level at the moment. So that was an issue brought up also by our PMA President, Dr. Atienza. So the yearly amount would be 4,200 and up to 29,400. However, our doctors need not pay 3 years. This was already corrected, Mr. Chair. They can pay a minimum of a quarter, 1/4 a year. So they need not pay 3 years. May I just correct the impression of our resource speaker, Dr. Atienza? Because before, PhilHealth had a policy that doctors had to pay for 3 years. That was before universal healthcare, because they can be accredited for 3 years. And we found out that sometimes they're not already paying their premiums. Therefore, we came out with a policy of a payment of 3 years. However, this was already suspended. So we already revised this, and the doctors can pay just a quarter, a minimum of 1/4 quarterly. They can pay quarterly. So that's already amended. They need not pay for 3 years. Okay. And inpatient benefits.
Can we just clarify that for just to be clear, VP? You're saying that 3 years to be covered, but now just 1/4 covered na sila. Is that your point?
No, my point is before there was an issue with our healthcare workers, because when they get accredited as a provider in PhilHealth, they get accredited for a period of 3 years. And for those 3 years, sometimes within those 3 years, the premiums are not being paid after they pay an initial payment. So we came out with a policy then that the physicians will pay a 3 years of premiums. But this was a time when the amount was still around 1,200 for a year. That was already years back. And therefore, Maliit lang actually yon. But we already changed this. Tumaas na ito because of universal healthcare. Tumaas ang kanilang premiums and we revised this policy. It's not active anymore. The doctors can pay only for a minimum of quarterly. They pay quarterly. They don't have to pay for the whole year. They can pay quarterly. So they don't even have to pay for 3 years.
But how does that affect their accreditation? How long is the accreditation?
The accreditation still remains for 3 years, and we just we bill them when they renew their accreditation. If they don't pay for the rest of the years, we bill them. But we encourage them to pay regularly, quarterly, if para hindi mabigat sa kanila. So that's the status at the moment.
Okay.
Mr.
Okay.
Chair?
Yeah, go ahead, Vice Chair Amy.
Wala, quick suggestion lang while I'm chewing. Sorry, you don't seem to be eating yet. But
I'm eating also. I'm also munching here. Wala pang nagla-lunch. Go ahead. Anyone who wants to eat, we
It's
understand.
unhealthy na. Okay, yes, Vice President Shirley Domingo, please. Perhaps it would be more useful to get a written revision of those instructions because these are fairly controversial among the medical community. Sana may kopya na lang ng instructions ninyo kasi naiba yan sa dating utos eh.
Yes, ma'am. It is already written actually. This was a policy that we amended already years back. So this is amended already.
Maybe it needs clarification kasi hindi naman ganyan on the ground ang nangyayari yung 3 years at saka yung quarterly. Parang wala pang may alam na quarterly yan eh.
Yes, ma'am. But some of our doctors already pay quarterly because we inform them. Maybe we will just make again an announcement and advisory on this.
Is that posted on your website, VP? Para or notice to the world na? Parang official gazette, then the whole world can take notice. Yan ang sinasabi ni Vice Chair Amy. Maganda yun.
Yes, sir. Yes, Mr. Chair. I believe it's in our website in one of our circulars. But this was already years ago.
If you don't mind, you reissue it in layman's language because sa probinsya, nasa 3 years pa rin eh. So thank you very
Yes, ma'am.
much.
Thank you, ma'am. We will do that, ma'am.
Thank you, Vice Chair Amy, for sharing that with us. Very good suggestion. Yeah, go ahead, VP Shirley.
Oh, well, your question is if we also had funds, the status of the funds for payment.
Yeah, makatulong ba sila tayo or is this something that can be accommodated? Parang cost sharing type of thing, given that well, it's not in the 2022 budget and we hope to change that. But for the rest of 2021, for instance, baka wala nang savings ang DOH. I don't know.
Mr. Chair, I offhand, I would say that would be difficult because we disburse our funds through payment of a reimbursement. So yes, sir. So giving a lump sum of money to pay the allowances of health workers, I don't think that's possible at the moment. But I can discuss this with our financial managers in PhilHealth.
Sige. Baka naman there's a creative way of doing it. Ano? I understand what you're saying, VP. Pero kung meron man, what if the health worker pays himself, then you reimburse him? O, the reimbursement siya, di ba? I don't know. Just trying to really think out of the box because it's very, very challenging. We'll appreciate a position from you. I'm sure you have many lawyers there who can study it.
Yes, sir. I'll bring it up, sir. I'll bring it up, sir. Thank you.
Yeah. Thanks. Are you done, VP?
Yes, sir. Unless there are any other questions that you would like to answer, for me to answer.
Yeah, we'll give a chance to the other resource persons. Thank you very much to PhilHealth VP Shirley Domingo. Can we hear from the League of Provinces of the Philippines? Because alam nyo, Your Honors, our health system is very disjointed. That's one of the comments made by our experts who've studied it because of the local government code. It's actually devolved, but yet it's we're spending so much at the national level. So ang comment ng iba, hindi makagalaw ang DOH sapagkat wala silang sundalo sa baba dahil nasa ilalim sila ng mga local governments. I want to get comments on that maybe from the LPP. I think Ms. Sanchez is who used to attend a lot of our hearings on representing the League of Provinces. Ms. Sanchez, thank you for waiting, ma'am. Salamat. Nice to see you again. You always used to attend our local government hearings, so you're welcome here. Go ahead, ma'am. Thank you for waiting.
Yes, so good afternoon, Mr. Chair. We already submitted our position paper last night. However, we would just like to read a very short portion for which the League of Provinces expresses its support and sees the need for an unequivocal policy statement on the continued grant of the COVID-19 Special Risk Allowance and active hazard duty pay, provision of life insurance, accommodation, transportation, and meals, and provision of compensation to those who have contracted the disease with the performance of their duties as healthcare workers and for those who died from it, for the duration of the declaration of the state of national public health emergency by the President. Healthcare professionals and other healthcare workers and other persons working in hospitals, healthcare facilities, medical or quarantine facilities of vaccination sites, and those administering medical assistance should rightfully be compensated with additional allowance and benefits sought for to be granted under Section 4 of both bills in recognition of their heroic efforts to address the healthcare needs of the Filipinos, especially those who have fallen ill from contracting the disease. So Senate Bills 2371 and 2398 both seek to institutionalize for the duration of the pandemic the benefits to health workers that they have been entitled to under RA 11494 or the Bayanihan to Recover as One Act until the latter lapsed on June 30, 2021. So, Mr. Chair, that is basically the key points of our position paper for the League of Provinces of the Philippines. We fully support the passage of these two bills. And as to the query, Mr. Chair, why is it that the national government is spending for this? Mr. Chair, we would like to say that the LGUs are also spending so much especially for COVID-19 response. Malaki ang the major expense items of the LGU are in healthcare at the same time, pati sa social services po. So I think that would be all, Mr. Chair. Thank you.
Yes, we acknowledge the role of the LGUs in the pandemic. They're at the forefront. Pero we also have to acknowledge that there are some, not all, but some LGUs where the health facilities are not quite up to scratch. And although they've been devolved to the national government, hindi na kailangan saluhin ng national government, in other words, yung mga provincial hospitals, without mentioning names, no? And we're trying to find solutions
Yes, Mr.
here.
Chair, we acknowledge that po.
Yeah. Thank you, Ms. Sanchez. I think, is there anyone who has not? I think DBM might want to say something in addition to their reaction earlier. Meron pa ba kay Director Abella or any of the
Yes,
resource
sir.
persons? Anything
If you would
else
allow
to
us, sir.
contribute?
Yes, sir. If you would
Yeah,
allow us,
go ahead.
sir. Actually, sir, we already submitted our position paper nung Monday, sir.
Yeah.
Ang aming ano lang, sir, is the fiscal implication of granting the allowances. Kasi nga ho, sir, if we compute the data or the estimates given by the DOH for the healthcare workers, if we compute the requirement for July 1 to September 12, 2021, for the COVID-19 SRA for 223,727 HWs, it would be 6,546,587,500. For the COVID-19 active hazard duty pay for 384,149 healthcare workers, it would be 2,881,192,500. If we compute it at July to December, it would be 15,711,810,000 for the SRA, and for the active hazard duty pay, it would be 6,914,862,000. If we compute it on an annual requirement, ito sir, yung ano lang sir ha, yung ang computation nito sir is yung 8 hours lang, nagre-render lang ng 8 hours of work per day at 22 working days for the SRA. And then yung ano actual hazard duty pay computed at full 3,000 na monthly. If we combine both the SRA and the active hazard duty pay for a full year requirement, it would cost us 45,253,344,000. Given sir the fiscal condition of the country, if you would allow sir that my colleague from the fiscal planning to present the fiscal position of the country, if you would allow sir.
How general or how specific is that fiscal position? Ho?
Sir, if you would allow.
Sige ho, sige ho. Mahaba ho ba yan? Kasi we have a hearing at 1 o'clock ho.
Hindi naman po siguro, sir. If you would allow Ms.
Sige po,
Jillian
sige po.
Servida
Go ahead, ho. Go ahead.
Good afternoon, Mr. Chairman, everybody. This is Jillian Servida from the Fiscal Planning and Reforms Bureau. So I just want to share po, just a brief overview of the fiscal condition of the fiscal position of the country. So for the national government fiscal position, currently we are experiencing muted revenues and high deficit and borrowing levels as a result, resulting to the current tight fiscal position, and as well as the adoption of the fiscal consolidation strategy. So given those, this will result to tighter fiscal space over the medium term. So we provided the details, the numbers in the position paper, Mr. Chairman. So I won't be discussing this or elaborating this any further, Mr. Chair. So yun lang po. Maraming salamat po.
Sige, paki-submit na lang ho. I think, is there anyone in the body who has not been recognized and given a chance to speak? Please, we'd like to give you, the committee would like to give you a chance right now.
Mr. Chair, may tao na.
Yeah, sandali lang, Robert. Tingnan muna natin kung merong hindi nakapagsalita. Anybody? If not, we'll give a chance to the others. Yeah, go ahead, Alliance of Health Workers, Mr.
Yes, sir.
Mendoza.
Mr. Chair,
Can you keep it short ho? Kasi may hearing pa
yes
ho
po.
kami sa Marawi.
May katanungan lang po, Mr. Chair, kasi gumagawa tayo ng panibagong bill po, Senate bill, What will happen yung mga hindi pa naibigay ng Department of Health, yung mga MAT, active hazard duty pay, yung from January to June, na nag-expire na yung ating bayanihan 2? Dapat naibigay pa rin po.
Secretary Duque, what is the answer to that?
Yes. Thank you, Mr. Chairman. So we're looking for the sources, additional sources for the grant of the meals, accommodation, and transportation allowances. And also we're looking at what possible amendments can be introduced to provide a clear legal basis for the grant of the MAT on top of the SRA and the AHDP for public health workers and SRA for both public and private healthcare workers. So yun lang po. But we are actively identifying and looking at possible sources of funds. I give my reassurance that this is what is being done.
Maraming salamat, Sec Doke.
Thank you, Secretary.
Thank you.
Thank you, Secretary. Vice Chair Amy, anything else before we wrap up? Okay, thank you. Thank you for your
Now we
support.
have the big job of looking for the money. Mr. Chairman, bahala ka na.
mahirap to. Malaki to. Okay.
Mr.
Thank you
Chair,
very
dagdag
much
lang po.
thank you very much. We're going to, go ahead. Patapos na ho tayo, sir.
Sir,
Opo,
Sir, sana,
may hearing pa ho
doon sa-
tayo. Sana bigyan nyo ng konsiderasyon, sir.
Kasi po, sir, sana doon sa paggagawa sa PWG sana makasama rin kami doon sa pag-wrap up ng
Yeah,
sa batas
we'll
po.
certainly be
Okay.
consulted. Opo.
Okay, maraming salamat po.
Salamat ho sa
Okay.
lahat po ng nag-attend, sa ating Vice Chair, Secretary Duque, and all the different... Secretary, did you want to say something? No?
I just said thank you. Thank you very much.
Okay, thank you. Salamat. And stay safe to everyone. Ingat po silang lahat. And thank you for your contributions. We'll try to come up with a good measure by next week, hopefully, para ma-sponsor at least before the break, and then we can finalize sana. So thank
Maraming
you,
salamat po.
Director.
Salamat po.
Yusek Ong,
Thank you po. Thank you, Senator.
Dr. Amy, thank you very much. Thank you
Good
very much.
afternoon. Nice day to you.
Salamat po. Salamat ng marami ho. Thank you. Ingat
Salamat
po.
po. Okay.